Good morning, folks. We are going to get started in about 5 minutes at 9:10. All right, folks, I think we're going to go ahead and get started. We have some advisory group members who's going to be joining us a little bit later, but for the sake of time, we'll go ahead and kick us off. Welcome, everyone. For those of you I haven't met, my name is Adriana Renteria. I'm the director for the Office of Public Participation. My pronouns are she and they, and I want to thank each and every one of you for making it out today. This is the first time in over 2 years that the Safer Advisory Group meets in person, so we want to welcome you back to Sacramento and to the California Environmental Protection Agency building. It's really good to see every one of you in person. Today's meeting is going to be taking place both here in the Coastal Hearing Room as well as remotely via the Cali, PA webcast. It's being webcast right now in both English and Spanish for members of the public to watch. Like all of our advisory group meetings, this meeting is going to be recorded and it's posted on our SAFER website afterwards. We want to begin our meeting with grounding in our vision, in our mission, and in the purpose of this advisory group. So the Water Board's mission is to preserve, enhance, and restore the quality of California's water resources for the benefit of present and future generations. The Safe and Affordable Funding for Equity and Resilience Drinking Water Program was created to bring environmental justice to California. And we hope that together, all of us can work to provide safe and affordable drinking water to all Californians. As we start today's meeting, I also want to acknowledge that the last couple of years have been really difficult. And I also want to acknowledge that COVID cases continue to increase. And we also want to acknowledge that several advisory group members were unable to join us in person today. Many of you reached out to us and asked if virtual participation could be possible. But unfortunately, because of public meeting requirements, we're unable to have advisory group members join us virtually. The reason is because the SAFER Advisory Group was created after the passage of Senate Bill 200, which established the advisory group as a statutory consultative body. As a statutory body, this advisory group is subject to Bagley-Keene open meeting requirements, which require that this group meet in person in order to support public transparency. So because of that reason, future advisory group meetings are also going to be taking place in person. The Senate Bill 200 created the SAFER Advisory Group to act as a consultative body for the State Water Board and to advise the State Water Board on aspects of the SAFER program, including the fund expenditure plan that we're going to be talking about today. We want to begin with clarifying that the SAFER Advisory Group is not authorized to approve documents or make policy decisions, to evaluate individual funding applications, or to advocate for funding or policies that would personally benefit the advisory group member making that recommendation. In our discussions today, we do not have to come to a consensus or an agreement. Sometimes we will use voting, but that's mainly for the purpose of understanding where we each are, but we welcome all perspectives and all experiences in this group. Today we're going to be taking notes, and after this meeting, those notes are shared with our State Water Board board members, and they use your feedback to inform the decisions that they make about the SAFER program. That's our purpose, the purpose of our advisory group. And before we jump into the purpose of today's meeting, we want to review a couple of housekeeping and guidelines. So the first one is at your seats, you all should have a meeting packet. That meeting packet includes the agenda for today, information about where to find food locations located nearby, PowerPoint slides, as well as the SAFER program updates. On the slide, we're going to be presenting information in English and Spanish, but if you'd rather follow along with your monolingual printed packet, feel free to do so. Today, our meeting is going to be, we're providing oral interpretation simultaneously in Spanish. So we ask everyone to speak slowly. And if someone is speaking quickly, we'll try to give them a reminder to slow down. We have 2 breaks scheduled throughout today's meeting, but you're welcome to take breaks whenever. You are welcome to just stand up and take a break. We have restrooms located down the hall. If you go down the left, take another left after the glass statue or the glass ceiling fixture, and you'll see the restrooms and the drinking water fountains. We have recycling outside of this room. Just exit these back doors. And then in the event of an emergency, we have a couple of exits here that we can use. We have the exit over there towards the back of the room. And then we have the 2 exit doors where you entered. In the event of a fire alarm going off, all of us are going to take our valuable belongings and exit the room using the stairs, and we're gonna meet at Cesar Chavez Park across the street. And then for members of the public who are joining us, we're gonna have a public comment period after the advisory group starts their discussion. And members of the public who are watching us virtually, you're able to email safer@waterboards.ca.gov to be added to the public comment list. All right, so jumping into today's agenda. So today we are gonna be discussing results of the 2022 Drinking Water Needs Assessment, and you'll have an opportunity to ask questions of the Division of Drinking Water. We'll have an opportunity to learn about draft fund expenditure plan priorities and get your feedback on how you think the board should prioritize safer funding. We'll have an opportunity to hear from the public. We'll share some safer program updates related to PFAS and offer an opportunity for you all to ask questions related to other elements of the safer program. And then we'll close out by hearing your announcements. So as advisory group members, if there's any opportunities, announcements, or things that you would like to share with the group relevant to safe drinking water, we have an opportunity at the end of today's meeting to do so. All right, before we jump into our warmer today, do we have any questions or clarifications on our guidelines or today's agenda? No? All right, I'll pass the mic to Itzel.
All right, thank you, Adriana. And hi, everyone. It's so good to see those of you who are in person today, and welcome to the folks watching online as well. Okay, and Adriana, if you want to go to the next slide, please. Our introductions and warmer today, we're each going to take about, 20 seconds or so to share your name, your affiliation, where you came from today, or your location. And our warmer question is, what are you looking forward to most post-pandemic? So as Adriana mentioned earlier, we are very much still in the midst of COVID pandemic, and we heard concerns about that as well. But we're gonna take some time today to ground ourselves and also look forward and have some hope to what we'd like to do post-pandemic. So with that, I'm gonna start us off on my right-hand side of the table with Sandra, and then we'll go down here towards the U, and we'll end up with you, Jonathan, on the other side of the table. So Sandra, if you'll kick us off. Oh, and I'm sorry, to turn on the mics, there's one mic per table. You'll press the button, the green light will come on, and then you will press the button again, and it will turn off.
Okay, thank you. I'm Sandra Chavez. I'm from Porterville, and I'm a domestic well owner. And what I'm looking forward to most post-pandemic is being able to have meetings like this. In this terms, but I also look forward to doing more things with school and other nonprofits, and just being able to hang around with people, meet new people. And yeah, it's really nice to see you all in person. Thank you.
Good morning, everyone. My name is Rame Kalon. I'm with California Water Service. California Water Service is the second largest water utility in California. We serve about 2 million folks from Chico down to Los Angeles. California Water Service is based in San Jose, California. That's our headquarters. So of course, we have offices throughout the state. I'm most looking forward to working with the SAFER group in person and helping advance California's policy objectives for small water systems, and getting some consolidations done. Thank you.
Good morning. My name is Don James. I'm with Tolowadini Nation. We're located in Smith River, California, which is the farthest north you can go in California, west, farthest northwest to the ocean, redwoods, Smith River. I'm looking forward to in-person meetings, trainings. I'm also looking forward to being able to take our children wherever we can go without a ton of restrictions. So and I'm looking forward to when the gas comes down a little bit, so.
Good morning, I'm Camille Panu. I'm not at the UC Davis Water Justice Clinic. I'm at UC Irvine, and I am a public representative, so I represent the public at large on the board. Um, Gosh, what else? My location in Irvine. I live in Irvine, so came up for this. What I'm looking forward to most post-pandemic is meeting people. I'm a little anxious because I was already pretty socially awkward before the pandemic, and so seeing humans again is different, but it's really nice. I've really missed getting to be around people. So.
Good morning, everyone. My name is Jianming Huang. I'm coming from Yolo County Environmental Health. Today, I commuted from Davis, so I think I'm really lucky because my commute time is like 20 minutes. What I'm looking for post-pandemic is more human interactions, and also from the personal perspective, I'm hoping to be able to see my mom in a foreign country. Thank you.
Morning, everyone. I'm Jim Sullivan. I'm from the town of Mendocino, very rural area, and I'm a private well owner, as well as everyone in the basic area that we're in is on private wells. What I'm looking forward to as a person that wears glasses, getting rid of these would be great, and I'm really looking forward to that. So, and interacting with folks again. So that's it.
You're not introducing yourselves. Kristen, how about Kristen?
Good morning, everyone. I'm Kristen Appold. I am with the Division of Drinking Water here at the State Water Board, and I am based here in Sacramento, and I can't wait to get on an airplane again. I've got family abroad, and I would love to go visit. So thank you.
Yeah, good morning. I'm Cassie Chahan. I'm with the North Kings Groundwater Sustainability Agency. I'm based in Fresno, and I'm also looking forward to interaction. I love people. I love the amount of meaningful discussion that you can have when you're in a room with people, and I'm looking forward to getting to know each of you better and working with you on this very important issue we have before us.
Hi, good morning. My name is Castulo Estrada. I'm with the Coachella Valley Water District. I'm a board director for the Coachella Valley Water District, and I also work for the city of Coachella. That's my full-time job. I'm looking forward to pretty much what everybody said. I was going to say I'm looking forward to things getting back to normal, but yeah, I don't know what that is, normal. But it is going out with the kids without a bunch of restrictions, meeting folks in person. I wasn't a big fan of virtual meetings. I tend to work better being at the office and having meetings in person. So looking forward to that. Looking forward to continuing to work with the State Water Board on all the things that we've been working on. So happy to be here. Thank you.
Good morning, everyone. My name is Horacio Mezquita. I used to live in San Gerardo Cooperatives in the Salinas Valley. It's a co-op for farm workers. I don't longer work for them, but I still advocate for them and for disadvantaged communities in the Salinas Valley that don't have drinking water for 20, 30, 40 years. So I hope with this new way of maybe meeting together here, we can discuss better ways of mitigating water contamination and providing clean water for everyone, because we need clean water. So hopefully by meeting in person, we can have better debates, better comments, better discussions instead of being in the computer. Thank you.
Good morning, everyone. I'm Jennifer Hazard with the Rural Community Assistance Corporation, and as it relates to SAFER, we provide technical assistance to small community water systems, actually any small public water systems in a disadvantaged community, to help them upgrade their system. We just provide technical assistance for anything that they might need that can be funded by SAFER. And I came from San Diego County. And I'm looking forward to more in-person meetings. I just think they're more productive. and looking forward to being able to shake someone's hand and give them a hug. Thank you.
Good morning, everyone. I am Sergio Carranza with Pueblo Unido CDC. We are located in the city of La Quinta and the Coachella Valley. I am very thankful that for the first time after almost, I think, over 2 years, we're able to meet again. But during this pandemic, I realized how difficult the conditions of the families that we represent are, how they were able to be resilient, and on top of all these disadvantaged conditions they have this pandemic, or that for me was remarkable. So what is it that I really want to focus on? The first thing that came to my head is just to continue pushing for all the resources that those communities need, and when it comes to drinking water, through, even through interim solutions, and of course, to help them to consolidate to local municipal systems. So I am very, very energetic and very thankful to be with all of you here, and I believe that we have all the expertise that we need, together with the guidance from the state water boards. We're definitely going to make this a reality. Thank you.
Buenos días a todos. Mi
Good
nombre es
morning,
María Luisa
everybody.
Muñoz. Me da muchísimo gusto verlos de frente.
I'm really happy to be here and meet you all.
Algo que no se podía ver en 2 años para atrás cuando empecé todo esto.
We weren't
Para
able
mí
to
es
see each other for 2
de
years.
verdad es algo muy nuevo para mí.
Something very new to me right now to be here with you.
Discúlpeme por lo que estoy nerviosa.
So I'm so sorry I'm
Pero
nervous,
hicimos todo el esfuerzo por llegar hasta este lugar.
but we made a lot of
Pudimos
effort to be able to be here with you today.
Y es uno de los lugares que represento.
And it's one of the places that I
Estoy
represent.
feliz de estar con ustedes,
I'm
de
happy to be here
conocer a
with you
cada uno de ustedes y no
and-
estarnos viendo nada más por el Zoom.
And meet with you all and not just be through
Podemos
Zoom.
interactuar unos al otros, podemos aprender unos del otro,
That way we
podemos
can
estar
be
haciendo
here
las comunidades
and learn
y
here from each
conocer
other
realmente lo
and
que es el
represent our
liderazgo.
communities.
Y esta es mi representación.
That's my
Muchísimas gracias.
representation to you. Thank you.
Good morning, everyone. My name is Michael Rincon. I am with Physicians for Social Responsibility Los Angeles. We are a public health organization that works in collaboration with community-based organizations to identify community-based solutions to address public health hazards and community health threats. We specifically, around water, have been working on drinking water issues in Southeast LA and in the greater LA area, mostly just identifying, assessing, and trying to address threats to the human right to water. And I'm personally from Thousand Oaks in Ventura County.
Hello, my name is Jonathan Rash. I'm based here in Sacramento. I work for the Indian Health Service, which is a federal government agency under the Department of Health and Human Services. And I am here to advocate for tribal water systems and tribal domestic well owners and make sure that they are represented and that they have an equal opportunity to participate in the SAFER program. Thanks.
Okay, thank you all so much for sharing. It's great to see you all in person, and to see that we have folks from such a wide swath of the state here today. In hearing your comments on what you're looking forward to most post-pandemic, I heard a lot about meeting in person, seeing each other, connecting, seeing loved ones and family. And so I'm glad that we have the opportunity today with this meeting to have it in person and be able to connect a little bit better. So thank you all. I do want to remind folks that we are hosting this meeting in Spanish as well as in English. So when you speak, if you can pause so that the interpreters can have time to relay what you are saying into the other language, that would be great. And with that, I'm going to go ahead and introduce our first presenter, Kristen Abholt with our Division of Drinking Water, who will be giving an overview of the updated needs assessment. Kristen will be taking questions at the end of her presentation. In your packet, you all should have a printed copy of the PowerPoint that you can follow along with. Just as an FYI, the PowerPoint slides that we're showing on the screen here today are in Spanish and English. So Kristen will be flipping through slides midway between her talking points between those two languages. But the PowerPoints in your packets are only in one language. So you may notice a difference between the slides here on the screen and the slides in your packet, but just know that the information is all the same. And with that, I'll go ahead and pass the mic.
Thanks so much. And I'm hoping that someone can help me advance the slides, because the next slide, please. The clicker doesn't seem to be working. Oh, there we go. There we go. Well, I think a number of you have participated in our workshops and other webinars that we've hosted on this topic, so I appreciate you sitting through this another time. I'm going to probably provide a very high-level overview of the needs assessment work that we do. If you are interested in learning more about this work, we have longer webinar presentations and reports and materials on our website. And please feel free to contact me at any time if you have additional questions. I just want to flag that for you. So the drinking water needs assessment is composed of 3 core components. There's a risk assessment, which we do for both community water systems and K-12 schools, as well as state small water systems and domestic wells. We then do a cost assessment, which is for those systems that are failing or at risk. And then we also do an affordability assessment, which is trying to identify communities that may have challenges in affording some of the improvements and things that they need to do to not fail and to be off of our at-risk list. So I'm going to walk through the results of the 2022 assessment and highlight some of the key changes that have occurred this year. Just to remind folks, the purpose of the needs assessment is to help the Water Board create a prioritization list of water systems and communities for our funding and technical assistance resources. I like to show this priority pyramid just to iterate this point one more time. Failing systems are always going to be our top priority, followed by our at-risk systems and domestic well communities, potentially at risk, and then not at risk. You'll see that we try to use this color coding system throughout our report and our new dashboard. The full report is on our website, and I encourage you all to take a look at it. We fully document our methodologies, our assumptions, and we have lots of graphs and figures. I will warn you, it is nearly 300 pages and not light reading, so if you want to fall asleep, this can help you potentially. All right, let's get into it. So one of the biggest changes that we've made to the risk assessment this year for public water systems is that we have expanded the inventory of systems that we are analyzing in the assessment. Last year, we only looked at systems with 3,300 connections or less. This year, we expanded it to systems up to 30,000 connections or a population of 100,000 served. One of the reasons why we did this is because we do have expanded funding eligibilities with our programs and wanted to make sure that those systems were then included in our analysis because they do have these funding eligibilities now. A few other changes we made to the risk assessment is that we have added or removed risk indicators or data points in the assessment. We also changed how we calculate a few of our indicators in order to accommodate the medium-sized systems that are now included in the assessment. I'm not going to go through each one of these, but you can see the blue highlighted indicators are new, and then we have a few red ones that have been struck out. The new ones are in a response to either a lack of data or new data becoming available, and also in response to feedback that we have received from you and from the public after the release of our first risk assessment on how we might be able to improve it. So a lot of this was in response to great recommendations from the public and stakeholders. We do document in the paper why we removed and added indicators. So if you're interested in the reasoning behind that, I encourage you to check out the paper. So let's get into the results. Fairly similar to the results that we had last year. We still have over 300 failing water systems. We have 508 at-risk systems, 453 potentially at risk, and a majority of our systems are not at risk in that green column, nearly 1,800. I do want to iterate, though, that some of those failing water systems, if they were to come off the failing list, you would see that they performed poorly in the risk assessment and then would be considered an at-risk water system. So those numbers are actually a bit higher if you were to not look at the failing system side by side with the at-risk system. I'm going to do a really brief demo of a new dashboard that we released this year to help the public and our own staff navigate the results of the risk assessment. It was one of the big pieces of feedback that we got last year, was that it was difficult to navigate the results and figure out, well, why is a system at risk or failing, or why are they not? I'm going to share my screen here and show you how to navigate it very briefly. Okay. Try to make it full screen too, so it's a little bit easier to see. There we go. You can see that at the top of the screen, we have some high-level stats, and for those of you in the room, it looks like we're a little delayed here, but I'll talk about it as we wait for IT to catch up. At the top of the screen, we try to provide some high-level stats of the total population and connections served by the different categories of systems. So we have failing, at risk, not at risk. We also include a summary of the amount of funding that's been provided to those systems in those categories since 2017. So it doesn't encapsulate all of the funding that's been provided to these systems, but it is a snapshot of recent funding. We do have a number of filters on the left-hand side of the dashboard that will allow you to filter by location, by population size, county. You can look at by regulating agency. You can also look at just the disadvantaged community systems. And you can also filter and see which systems have received funding or have not received funding since 2017. It's very dynamic. If you click on a system or one of the risk indicators on the right-hand side, it will pop up and show you definitions. It will show you the list of systems below the dashboard that are meeting criteria or whatever you're clicking on. It doesn't seem like the dashboard's going to be displaying anytime soon, so I'm just going to encourage you all to play with it in your own time. I will say one last thing that you can do, which is something we're very proud of, is if you type in a water system's PWS ID, its system name, or you zoom in on a map and just click on one of those point locations, it will take you to a profile page of that water system, which will tell you why that system may be on the failing list. So if it's a red dot, it will say whether or not they're meeting a primary MCL violation, maybe they have the treatment technique violations, and it'll say which contaminants are related to those violations. You can also see how they performed in the risk assessment for all of our 22 risk indicators. So again, if you see a system that's on this list and you want to know, well, why are they at risk? You can see where they performed poorly. And again, definitions and criteria are all provided in the dashboard. Well, that was our risk assessment for public water systems. We've also done a risk assessment for state smalls and domestic wells. It obviously needs to be a different type of analysis because we have different data for these types of communities. One thing that we're super proud of is this year we actually included a whole new data set in our analysis, which is looking at drought risk. For those who followed along last year, we only looked at water quality risk for these areas. And one of the key pieces of feedback that we got from the advisor group was, can you start making the risk assessment for state small water systems and domestic wells more similar to your risk assessment for public water systems? So step one was to see if we could include this drought risk. So we worked with our colleagues over the Department of Water Resources to create a combined methodology using their drought risk assessment. Now, there are folks who are interested in looking at the results of both assessments side by side and then combined. And in the map that we generated, we did try to pull that out. And we did include the breakdown of that data and analysis in our report as well. The map is available on our website. And I just want to highlight the color coding here. There is a legend in the map online and in our report. The green areas are areas that are high risk for drought, but not at high risk for water quality. The pink areas are at high risk for water quality, but not for drought. And the purple areas, that deep purple blue color, are areas that are high risk for both water quality and drought. What we've done in this map is we have masked areas where we do not have data for a known well in that location. However, if you zoom in on the map and you've got a well there, you can take that layer off and you can see what color it is underneath. We just didn't want to make it too messy on the screen. Some of the other improvements we've made to the map this year is if you hover your cursor over a location, you'll be able to see the Cal EnviroScore environmental pollution metrics. You can also see a few other socioeconomic metrics displayed around poverty, around ethnic and racial makeup of that area using census data. The results, somewhat similar again to last year, but now we've got this newly added drought area. I'm just highlighting the results for domestic wells here, but we had 92,000 that were at risk for water quality. We had 90,000 at risk for drought. And then we have 64,000 that are at risk for both. So you can slice and dice the data either way, but we thought it was important in order to highlight the ones that were most vulnerable so that we know where we should perhaps be targeting our outreach efforts and our resources. Again, what we have in our report does break down the results for state smalls. I just did not include that in the slide deck today. We're not done though. I do want to emphasize that we are continuing to make strides in trying to improve our risk assessment for state smalls and domestic wells to more closely align our methodology for public water systems. We've been working with the Office of Environmental Health Hazard Assessment to develop a new layer of data to look at socioeconomic risk of communities that are served by domestic wells and state smalls. We are going to be hosting a series of workshops this year to introduce some of our recommended metrics and methods for looking at socioeconomic risk along with water quality and drought risk to, again, better identify areas that should be targeted potentially for technical assistance and funding resources. As you all know, there is limited data available, and we are working with counties and many others to try to identify new data sources to improve our analysis, and we're always looking for recommendations, so please don't hesitate to contact me if you are aware of any new data that we should be including in our assessment of these communities. The second component of our needs assessment is the cost assessment. We did do a full-blown cost assessment last year for our failing and at-risk water systems, domestic wells, and state smalls. We did not anticipate that that full statewide number would change much this year, since the number of systems that were at risk and failing did not change much. Instead, we started thinking how we could be useful, and SB 552 was passed in the fall of last year, which includes some new requirements for small water systems around drought infrastructure resiliency improvements. Now, we wanted to provide a cost estimate of what it might be to take to implement these requirements I'm going to just walk through them at a very high level and then show you the number. Small water systems in K through 12 schools must be able to detect production well groundwater levels. They need to be a member of a mutual aid organization. They need to be able to provide continuous operation during power failures, so have a backup generator. They need to be able to meter all their service connections. They have to have a backup source or have an intertie. And then the last one is they have to meet Fireflow requirements. Now, we were unable to do a cost estimate for Fireflow requirements because there is just not enough data out there to do that. But we did have enough data to do a pretty good estimate of the first batch of requirements. I will say, though, that we do have a lot of assumptions we had to make with our underlying data collected through the electronic annual report that is detailed in our report. We do post the data behind this assessment on our website. So if you're interested in whether or not we said that your system or your water system was complying with these different requirements and whether or not we costed out these solutions for your system, that is available on our website. If we made an inaccurate assumption about what infrastructure a system does have, you can submit a data change request to our unit and we will work on updating those figures. We found that a lot of small water systems were not complying with the backup generator and metering all service connections. You can see here that we have a lot of systems that may need to make these infrastructure improvements over the coming years. And here were the results. We do include minimum and maximum ranges in the report, but here I provided the point estimates. You can see that the price tag is quite big, and this is excluding Fireflow requirements, which we anticipate would be a huge number for most communities. The point estimate here is $2.4 billion. You can see that a lot of water systems aren't currently a member of Cal Warren. However, thankfully that price tag is $0 and it is free. We're hoping that most water systems will join those mutual aid organizations like Cal Warren to be prepared for emergencies. Last but not least, we did our affordability assessment. We did need to change the data that was utilized in the assessment due to the lack of data around shutoffs. There was a shutoff moratorium issued by the governor during the COVID-19 pandemic. However, we did replace that indicator with the arrearage or debt data that we collected when we implemented the arrearage payment program in the fall of last year. What that is essentially looking at is the number of customers that were behind on paying their bills and the extent in which they were behind on their bills. We continue to use percent median household income, which is looking at the percentage of a household's income that goes towards their water bills each year, as well as extreme water bill, which is looking at, well, how pricey is their water compared to other water systems throughout the state. We do anticipate that these indicators are going to be evolving over time. It's one of kind of the newer spaces of data analysis that the Water Board is getting into, and we're going to be hosting a lot of workshops on this. We do slice and dice the data in the affordability assessment a number of ways in the report. SB 200 requires that we look at the DAC and SDAC, or disadvantaged communities, that are meeting our affordability threshold. We also slice it by our safer status, so whether or not those systems are failing or at risk, which is why these numbers are broken out so much. You can see here that there's failing systems that are DAC, SDAC that are really high for affordability burden. They're only 10% or 19. We don't see strong trends in the data here, but we do anticipate this is probably due to differences in rates and other socioeconomic issues that we aren't capturing in the assessment. We do also provide a breakdown of the systems and the data that are meeting these affordability thresholds on our website and also in the dashboard. You can take a look at it there too. I will say though, when you apply the DAC and SDAC filter, it really dramatically reduces the number of systems that are meeting the affordability threshold. By saying that a water system is disadvantaged, which is looking purely at the community's median household income, you are essentially applying a first step filter before you look at anybody else, which I think really reduces these numbers as well. Like I mentioned, we are working with OEHA on our state small and domestic well map for socioeconomic indicators. We're also working with them on some new affordability indicators. You may not realize, but because all of those indicators that we're currently utilizing rely on water rates data, it relies on a system actually charging their customers directly for water. We end up excluding some systems from the affordability assessment. For example, mobile home parks, which don't often charge their customers directly for water, are essentially excluded because there's no data for them. So we are trying to develop some new indicators that use census data in order to include those systems in the affordability assessment. So we're looking at poverty prevalence and housing cost burden to try to develop some new metrics for the affordability assessment. We are going to be hosting a series of workshops this year, very soon, hopefully in the next 2 months, our first one, and I encourage you to participate in those. We're going to be soliciting recommendations for new metrics beyond the ones that I have here on the screen. And we're also looking for recommendations on the best method to look at all of these different metrics together. With that, I'm available for questions if you have any.
I do have several questions and some comments. I wasn't sure whether to try to jump in during your presentation or save them all for the end, but then they kind of accumulated. So I'm going to try to just and some of them they kind of tie into the next question, so it's all kind of part of the same thing. But as you were going through the presentation, I was making some notes. So thank you. I think it was a great presentation.
And Castulo, sorry, just quickly,
Yes.
as a reminder for everyone, if you can bring the mic as close to your face as you can so that folks online can hear us as well.
Okay.
Much appreciated.
Thank you.
Thank you.
Okay, so kind of starting with the priority on the needs assessment, and you kind of get to that throughout the presentation. I was wondering what the difference, if there was like something that you could point to that would show us what is the difference between an at-risk system and a potentially at-risk system. So that's one. And then I was thinking about this, the new assessment now, which it's up to 30,000 service connections and up to 100,000 population. And I was tying that to the risk indicators. And as you were going through that, I was thinking about the risk indicator, water quality, and the new one that you show here, constituents of emerging concern. And you know, in our area, we have naturally occurring arsenic, and I brought this up before. And I'm trying to figure out if it makes sense that constituents of emerging concern would also have an impact on the affordability indicator. And I don't see that here. And I don't know if it's when you're thinking about affordability, whether there's a component from constituents of emerging concern that then would put a burden on the affordability indicator as well. It almost seems like it has to hit both of them, and I don't know if it's hitting the affordability or not. And so that was a comment, is whether you know, we know that for example, let's just take the city of Coachella. City of Coachella has 6 wells. It provides water to 45,000 people. It has about 9,000 connections. All of the 6 wells are exceeding the 10 parts per billion MCL, which we know it's probably a matter of time before we have to come up with some sort of plan to add treatment to be able to be in compliance. And so all my questions are kind of centered around the thought of at what point do I get to see in the map when I go and look at the city of Coachella's water system and I click on it, at what point is that system going to be considered at risk, knowing that it's only a matter of time that the MCL is going to put us above the MCL? And then at what point do you incorporate the cost associated for treatment into the affordability indicator that would put it in a, perhaps in a potential spot for funding? So that's kind of what I'm thinking about. Do we? Yeah. So that's kind of where I was going with that. And then let me see. And I do like the idea of using OEHA as part of the risk assessment. And as you were talking about that, I was wondering if you had an example of what a socioeconomic risk indicator looks like.
Yeah.
I was thinking, what is that? So I was wondering if you could share a little bit about that. And then I had a comment on slide 21 where you talked about estimated number of systems not meeting SB 552 requirements. And I just wanted to mention that I think that all the small water systems, state smalls that we have in the Coachella Valley, which are over 100 of them, none of them, the majority of them probably have no backup generators, and they have no meter service connections. And one thing that I wanted to highlight is that in the Coachella Valley, we have pretty strong winds. It's a desert, and every year it knocks down the power poles.
Yeah.
And once the power poles get knocked down, those systems can't use their wells. So it is an issue. And then you talked a little bit about the affordability assessment and removing the shutoff percentage as an indicator. But you mentioned that it's kind of like it's going to keep changing. So I made a note here. Are you going to bring it back? Because, for example, at the water district, we've gone back to shutoffs. So I'm just wondering if you think you're going to bring it back at one point. And then just another comment that I made here on slide 24 is a sense that I think constituents of emerging concern hit both the water quality indicator and the affordability indicator. And that's it for me. Thank you.
Thank you. I really appreciate your comments and your questions. I'm going to try to walk through all of them, and you let me know if I've missed anything, okay? The difference between an at-risk water system and a potentially at-risk water system is risk point accumulation. We wanted to identify the systems that are getting a few risk points in the assessment. They're not at risk yet, but you want to maybe be concerned about how you're performing because you don't want to be at risk. We have debated whether or not we should just get rid of that category in general. So your feedback here is useful. We are trying to figure out what to do with that category because right now failing and at-risk are our top priorities, and that's where our authorities lie as well. We do have in the report the breakdown of the thresholds on how we determine, which systems are potentially at risk or not at risk or at risk with the different point accumulation numbers. So you can look at that if you're interested. Around constituents of emerging concern and how some of the indicators in the risk assessment may be interrelated, we think it's a good point. And I'm going to touch on that just one moment, but I want to linger a little bit on the risk indicators. We do anticipate that some of them play into each other, right? A system that is experiencing issues may be experiencing issues because on the financial side, they're struggling. So you can see there are systems, and if you toggle with the dashboard, you'll see the ones that are performing poorly with the financial indicators, and then you might see the trend across some of the other ones. When we start talking about affordability, though, you're right, and that we haven't connected the dots all the way. We have systems that are at risk. We have some high-level cost estimate, and then we haven't done a full analysis of if these systems needed to make these investments, could they afford it? Because our current affordability assessment is a snapshot in time looking at current metrics, your current rates, your current income data, your current shutoff or arrearage data. It's not forecasting how much that system would need to increase their rates to cover modeled or projected costs associated with dealing with current contamination issues or future contamination issues. I think in order for us to be effective in doing that, we definitely need to collect better data in order to have a much better cost model, because I would hate to do an affordability assessment for future costs that there's so many embedded assumptions in there. But that's something that's I think a lofty goal for our work in the future. But we do hope that the results of the affordability assessment that's looking at the current conditions of a system in their community are helpful in at least gauging whether or not that system today could be able to address some of those challenges. Again, it's why we're hoping that it's used to inform some of the funding decision and technical assistance decision that our agency is making and others. So it's a really good point, and one that we would love to do. We just need to figure out a path to get there. We are working with OWIHA on the new affordability indicators, the one that you're mentioning for state smalls and domestic wells. We are looking at poverty prevalence and housing burden costs, but some other examples specific to state smalls and domestic wells, and we're very excited about this, is we've done some research looking at the resources available at the county level to see what funding may exist at counties to support domestic well and state small communities, and then the cost of drilling a new well, deepening a well, or decommissioning a well within the county. That data is very interesting. It's very different from county to county, the costs associated with wells, which is obviously a burden for well owners if you need to go out and deepen your well or build a new well. And so those are some examples of socioeconomic indicators that we're going to be proposing with OWIHA through our workshops. And I encourage you all, especially the domestic well owners that's sitting around the table, to please participate in those workshops. I'm trying to figure out the last question. You help me out here.
There was the
shutoffs. Thank you.
Yeah, the shutoffs.
Yeah. So there's been talk about whether or not we should include the shutoff data in the future now that shutoffs resumed, or if we should be looking at arrearage or debt data. I'll tell you, I'm torn on this one because I think shutoff data has always been a really good indicator of affordability, but there are a lot of requirements now, especially for larger systems, where they need to help folks who are behind on their bills by putting them on a payment plan. If a customer is on a payment plan, they still have debt. They're just trying to pay it off in a different way, but they're not being shut off. So essentially, your shutoff data is not fully capturing the full breadth of your customers that may be experiencing affordability challenges. So if we're trying to measure affordability, I think one of the most direct measurements is the number of customers and the extent in which they're in debt or behind on paying their bills. So I think that's something that we want to talk about with workshop participants this year as we host those, and I would love your opinions on that as we dig in.
Yeah, and thank you for answering everything. I think you covered everything. And now that you touched on the shutoffs, I think you make a good point, where it seems like although we've brought back the shutoffs, it almost seems like there's things in place to prevent shutoffs. So it's really hard to get to a shutoff. Right. So you're right. It's probably better to look at the debt to really see the full picture of folks that are struggling with paying their bills. Now, do you know if it's going to be a challenge if, for example, there's a lot of water agencies that send the debt to the county to collect that through the county, through their property taxes. Mm-hmm. Would that be an issue for the water board, or would we be able to just simply show you, here, hey, look, here's how much we sent the county?
Exactly.
What are your thoughts on that?
No, you bring a good point, and something that we ran into with our arrearage or debt payment program that we had last year. what I'm hoping to do out of these affordability workshops, once we can narrow down and figure out what data points we actually are going to be using in future affordability assessments, whether it's shut-off or arrearage data, how do we completely revamp the questions that we're asking in our electronic annual report to narrow it down? If anyone is familiar with the electronic annual report that water systems have to complete, this section is the largest and most cumbersome for systems to try to answer. So I want to streamline it. We did add this year a question, which was a very basic, are you transferring your debt to a third party, right? We had a few options. The EAR is closed. We're going to start analyzing that, but we can use that information to try to, again, figure out how do we best collect arrearage or shut-off data moving forward so that we can really do an effective affordability assessment. So it's a good point. One we're trying to think through, and we want your help.
Okay, thank you so much, Kristen.
Of course.
Hello. I had a couple of things to build off of my colleague on the right over there. Sorry, I can't think of your name tag. Starting with the risk indicator changes, I'm curious as to why the water source types was removed, because going into the drought, water source types matter when it comes to planning ahead of this drought and trying to mitigate. And so there was that. And then I would, in response to the removal of the percent shutoffs in affordability, I understand that doesn't necessarily reflect the overall water system picture, I guess I would say, but could we still keep the percent shutoffs, but as a way to kind of compare percent of residential arrearages, and then out of that, who is actually getting their water shut off? Because I think that's kind of a good way to kind of analyze affordability. And so that's my personal recommendation. And then I'm just kind of curious if also in the accessibility piece that was added, the bottled or hauled water reliance, is that also being taken into consideration in affordability? Because I'm assuming that if a water source or if a water system has to rely on other water sources, that cost for the water system will be reflected in customers' bills. So I'm just wondering if there's a way to kind of how we're planning to take that into consideration. So I'll stop there because I have a couple more things, but I'll give you a sec there.
Hi, and then just as a reminder, folks, I think we have a number of people with questions. So if you do have questions, please turn your name card up, as I see some of you have done, so that we know that you're in the queue. And then please be sure to speak into your microphone. You can move the microphone closer to you as well. Should be okay.
Thank you. You make an excellent point. I think there's a lot of things we can do in the affordability space, and your recommendation to continue to collect percent shutoff data as well as arrearage data, could be an option for us moving forward, and to look at all of them together. Just a reminder, because of the shutoff moratorium in 2020 into 2021, there was no data, absolutely zero data for us to use in this assessment. So that's why it was red line for this year, but it could come back again based on the recommendations out of our affordability workshops this year. So I appreciate your comments. The linkage between the cost of hauled water or bottled water and how it impacts affordability or even the financial performance of the system, we have not made that connection. We are not collecting data currently on the cost of bottled water or hauled water. We would assume, though, that it would ultimately be reflected in the rates data that we are collecting from water systems. So I think some additional or unique analysis we could be doing is looking at those systems that are relying on bottled and hauled water to see how that has changed or may change their rates over time, and if that does then impact how those systems are performing in the affordability assessment. So that would be an interesting analysis. We haven't gotten there yet. And we are, just pointing it out, the Water Board has not historically collected a lot of information around which systems are using hauled water. This data set is a unique one combined with the data we got from our financial assistance group. These are the communities that we're actually funding bottled water and hauled water. We get it from DWR, Department of Water Resources, if they're funding it. And then if we hear about it, we'll try to include that in the data set. But we're trying to do better about collecting data to really identify those systems that are relying on hauled water to meet their source demands. So it's a good point. And you said you had some additional questions?
Actually, you answered a couple of them in the process. Yeah, so one other question I had around affordability in the risk indicators. Were you able to figure out the differences between renters and homeowners, like bill-wise? Because that makes a huge difference in terms of affordability, especially in transparency as well. Because, for example, like I live in an apartment, and like my water bill comes through my rent, and I don't actually get to see my bill. So I mean, you know, I don't know what the situation is there. So I'm wondering if the state has figured out how to analyze that or get around that. Yeah, let's do that one first.
Sure. We do collect through the electronic annual report as best we can. We've made lots of modifications to try to improve this data set. We do include a breakdown of the average residential rate structure, as well as the average multifamily residential rate structure, and try to utilize that data. Currently, the affordability assessment is only utilizing the average residential rate information to then estimate what we think is the average customer charges for 6 HCF of water monthly, which then we take, you know, to the year. But we could look in a little bit further to multi-year, or multifamily, I apologize. But to get more specific at a granular level to try to get at like what renters may be paying, which is very difficult. You know that oftentimes, like I'm a renter, my water is embedded in my rent. I don't know what I'm actually using or what I'm paying for. And that's very difficult to tease out for affordability assessments. Again, it's why we're hopeful that we could use data that is not based on rates to try to get a sense of communities that may be experiencing affordability challenges.
Okay, wonderful, thank you. And then I did have a recommendation for the dashboard. I did notice that, I mean, when you play around with the map, I mean, you see the dots of the individual water systems, but I think it would be nice to know what the actual service area for that system is. It'd be very, very helpful, actually. And then the other thing, I wanted to uplift the urgency around contaminants of emerging concern and the effect on affordability. I often talk about PFAS in Southeast LA exceeding response levels, and then how does that impact the water security of the area? And so I'm just curious, like once an MCL is established, which it seems like OEHA is already in that process for PFOA and PFOS, you know, how is that going to impact small water systems to be able to invest in that technology to ensure that the PFAS is actually getting removed? So I just want to uplift that concern that was made earlier, or that urgency.
No, it's a good point. And the Water Board, through its, you know, MCL determination, does have to do an affordability assessment looking at whether or not, you know, what the cost would be to implement the new MCL requirement. So something we should probably try to loop in the future if we can. Yeah. I will say though, for the service area, if you click on a dot on the map, it should open the profile page for that location, which will show you the service area boundary if we have it in our data for that location. So, and if you notice that the boundary is not accurate, contact us because we'd like to get that updated in our database.
Thank you.
Yep. Kathy?
Yeah, hi, great job, Kristen. Thank you. I just had a few questions as well, taking notes while you were talking. The first one is in regards to the increased sample set that we're looking at, the medium sized water systems. I don't want to lose focus. I think that's my concern when we start going beyond the smalls until we really have solved the problem with the super small who have a very limited ability to pay. I think we're starting to lose focus. So I understand the need to look at medium-sized systems. I understand the need to forecast and foreshadow what those needs are going to be. but I just would like to see the report, in addition to the state smalls and the domestic wells, I would like to see this carve out that really keeps our focus on those super small systems because they have the most challenge in terms of ability to pay. And we've done a huge jump from 3,300 connections to 30,000. And that is just, I just don't want to lose focus. And I think the other thing that, so when we're presenting graphs like the ones on page 14, a sidebar that shows of the 3,066, these are the small, most severely impacted systems. And then the other question I had is in regards to your risk assessment map. I'm curious, when you were doing the evaluation, if you excluded wells, particularly domestic wells that are within boundaries of public water systems. Because there's a huge problem, and I'm not denying that there's a huge problem, but if the domestic well is located within an existing municipality boundary, chances are they're not going to be able to drill a new well. So they have a different problem, which is affording the connection to the public water system. But I just don't want to over exaggerate because there's a solution in place and one that we could fund and help fund to get them connected to a public water system. So to the extent possible, I think it makes sense to exclude domestic wells or at least somehow categorize or caveat that there's a certain group of the 64,000 wells that are located within public water system boundaries. And so the solution is imminent and there's funding available for when that happens. I think that's an important distinction that will help just better define the overall problem. And then in terms of mutual aid, I think I'm very familiar with CalWARN. I think it's great, but I also think that it's challenging for our smallest systems to tap into that resource. And so to the extent possible, having our third-party service providers push that system or some other mutual benefit type resource, because I know a lot of times it's not necessarily the CalWARN system, it's maybe the largest public water system in that area that has committed to helping provide services. I know that's true in several water systems that I've previously worked with. So somehow factoring that in, because it might not be CalWARN, but they may have a really good plan for when the power pole does go out and they need a generator. They call their friends at Coachella Valley Water District or whatever the case may be to bring those resources to the community. So, thank you.
I appreciate your comments and your recommendations. Definitely, I'll make sure I share them with the team. Next is...
Before we jump into comments, I just want to say we're a little bit behind, so we're going to cap it at these folks. We do have time at the end of the meeting for general SAFER program updates, so if there's something that we didn't get a chance to ask Kristen, we have drinking water staff who are going to stay throughout. So we'll cap it at the folks who have their hands up now, just to keep us moving along. And I think the next step, we had Camille, then Sandra, Horacio, Maria Luisa, and then Sergio.
Thank you. Hopefully my comments, are going to be somewhat brief, so that will leave time for everyone. Thank you so much for the analysis. I read most of the report, but have not finished the 300 pages, so this was really, really helpful and interesting. I wanted to hit on a couple of items that others have talked about, but with a little bit of a twist. With respect to reliance on hauled water or bottled water, if there's any way to get information or data that's not just from the water system, but rather from a community perspective, perhaps through the technical assistance program relationships that already exist or through other means for folks who are assisting communities that might not be in the TA system yet, I think that could be really helpful. Most of the communities I know that have a water safety hazard are also relying entirely on bottled water, which then has a massive affordability challenge. And so I think that last link back to affordability is what becomes the most important. But I understand that it's difficult to gather that data. So just wanted to put that out there. The other thing I wanted to flag with the SB 552 changes, particularly metering all service connections. So I understand this has been a policy priority for the state, and this is beyond our scope. And I'm pro metering. I do want to flag, though, that for mutual water companies in particular, once they meter, they lose their state tax exemption under the Business and Taxation Code, which then increases their costs, which affects affordability. This is particularly true for mutual water companies that are below 100 connections, which is a lot of them. I think something like something between 60% to 75% of mutual water companies serve populations that small. And at least for the folks who I've worked with in the past, avoiding that has been huge. This is like an administrative law issue that's beyond the scope of this group, but I do think the affordability key is in there because this goes back to forecasting, like you said, Kristen, which is difficult, but I can almost guarantee you that a bunch of systems are going to lose their state tax exemption if they have to comply with 552, and they do. The minimum tax is not particularly high for a functional system. It's $800 a year, but that can be catastrophic for these really tiny systems. And so I suspect that if it's catastrophic for them, they're showing up already and being at risk on the TMF indicators, but the affordability link is also there, and so I just wanted to flag that. It may change this year, but there's been a bill to amend this part of the law every year for the last 6 years, I want to say, and it hasn't passed yet. So yeah, it's a weird kind of quirk, but I wanted to flag that. I had some other comments, but I think I'm going to reserve them so other people can go. Thank you.
I wanted to talk about the risk assessment map. So for domestic wells, for the ones that aren't already on the map, I was wondering if, is there a plan to get these wells that aren't on the map? And how do we do that? And how does SAFER initiate that? Yes, I would really like to see something more with that, especially because as a domestic well owner, I feel like a lot of times I have to advocate for myself, whereas my city, my county doesn't advocate for me. And I'd like to mention that I am 21, right? So I don't think that's necessarily fair, because when my family had this problem with the domestic well, I was 14. And I have connections to my home. Therefore, I want to keep it a place to where I can live, you know? So I want to see what the counties can do, or just minimize how big it is, as in like the state advocating for me. I want my city, my county to be responsible to advocate for me. Yeah. And then I'd also like to talk about how Cassie, I think it is, was saying to not lose focus. So I was just wondering for like the SB 522, if domestic wells are involved in that. No. Is that because of the law? Because of the SB? Okay. All right. That's good.
I will touch briefly on the location data for domestic wells. The saying in my team right now around domestic well data, it's like the Wild West, trying to wrangle it. You know, it's just historically at the state level, we have not really kept track of it. We haven't required it. Counties are permitting wells. You know, now drillers have to submit a well completion report to the state, but that's only, you know, that's very recent data and does not capture most wells in the state that have been in existence for quite a while. So our data set is woefully incomplete. If you go to that map for the state smalls and domestic wells, you're not going to see point locations on where domestic wells are. It's broken up into 1 mile by 1 mile square blocks. And if you hover your mouse over it, you'll see the estimated number of domestic wells in that square mile location. We do have the actual location of those wells, but there is some controversy and different opinions about whether or not we should actually be specifically calling out point locations, because some homeowners maybe want their well displayed on the map, and there are others that do not. And so that's something that we're trying to grapple with as a program and across our different state agencies that work with domestic well data. I will say though, if your well is missing, or if you don't think that it's captured in the data set, You can contact us. We have a database here where we're starting to build out an inventory of domestic well locations for purposes of our risk assessment and others. We've been reaching out to counties to collect their location data, but I'll tell you, we've only collected 36,000 wells. We think there's over 400,000 out there, probably even more. And most counties have not provided the data. It's been like less than 5, I want to say. And that's detailed in the report. There's a retrospective section that will tell you which counties have actually provided the data that's required out of SB 200. So it is a challenge for us, but I appreciate you being here. Thank you.
And can I just add, this is Andrew Altsvog with the Division of Drinking Water, just on the SB 552 and as it relates to domestic wells. So there's a separate section in SB 552 that does apply to smalls and domestic wells. So the requirements are different, but really what it comes down to is each county is supposed to establish a drought task force, and then that drought task force is supposed to come up with a plan for the county, and that's planning for domestic wells and state smalls and drought preparedness. So that is a part of SB 552.
Does this have anything to do with SAFER within the domestic well?
Yeah, it is. We are linked up with it, definitely.
Okay.
And our engagement group that's working on the domestic well side of things is involved in that too. Yeah.
Thank you.
One other way that SAFER is involved in this domestic well connection, and we'll talk about it towards the end of the SAFER program, is that our Division of Financial Assistance through the SAFER program launched a county and regional domestic well program. So right now we are trying to work with counties or regional entities to develop domestic well programs that could include domestic well testing, interim bottled water, as well as planning for a long-term solution, whether it's consolidating systems or having other type of solutions. So towards the end, we'll talk about that a little more. But next up, we've got Horacio, Maria Luisa, and then Sergio.
Yeah, I was also concerned about how the counties should be responsible because what is happening in the local communities. You know, I live in the Salinas Valley, and 93% goes to of the water that is used goes to agriculture, and all the contamination that is happening with nitrates and pesticides and petrochemicals that are slipping into the aquifers. So we have many issues because most of the people that don't have drinking water that has been contaminated, they already got used to it because the counties are not doing anything. So what is the state going to do in order to have the counties be responsible to help out these communities get clean water? Because a lot of the water systems that are in the human right to water, you have someone that is helping a water system to be on the list. But what about the other ones that they're not getting any help? So if I know what is happening in my local communities, I'm not sure about Yuma or San Joaquin. I know a little bit, but I'm mostly know what is happening in the Salinas Valley. So we need to figure out how the state is going to make responsible the counties to make clean water available for the residents, and not just the state, because the state has thousands and thousands of water systems, and the county knows what's happening, what's best for the residents. So how does SAFER going to make this happen so we can create a system that is going to be more positive in a way that we're going to be using the resources to provide clean water to everyone. One of the ideas is, like Monterey County has like 1,200 water systems. Out of those, 250 out of compliance. They don't show in the human right to water. So what is the total of water systems in each county? How many are out of compliance? How many wells are industrial? How many wells are agriculture? How many wells are petrochemicals? All this data can be simple by counties. And we can get an idea of how we're going to connect everyone in a way that is not going to be impossible to have clean water and have communities being left out for 20, 30, 40 years. They've been left out. So I just want to see how we're going to approach this problem for all Californians. Anyway, that's my comments.
Thank you for your comments. I'm not sure if Andrew or Michelle wanted to talk a little bit about some other county outreach that we're doing. Just putting that out there. No? All right.
All right, so next up we have Maria Luisa, and she'll be speaking, and we'll hear the English interpretation here in the room out loud, so just bear with us.
I'm sorry por eso. Okay. Tengo nomás una pregunta.
I only have one
un
question.
comentario. De que siempre he preguntado por qué siempre en los documentos miro
I
que
always ask why in the
más cosas
documents
como letras únicamente es algo científico,
this
es
is
algo más
something that is
técnico.
only typical.
Nuestra población es hispana, ¿verdad? Es pobre.
My
María
congregation
Luisa,
is poor.
¿podemos pausar para que el intérprete pueda interpretar su comentario?
Ujú.
If the interpreter would like to translate, we'll pause.
Ok, la otra cosa que quiero saber es si puedes explicar más acerca de los talleres que fueron previstos para la primavera.
Also, I'd like to
Esto-
know if you can talk a little bit more about the panels that we were supposed to be having.
Fueron en la primavera del 2022. Se
It was
llevaron
in
a cabo,
2022.
están previstos para el futuro.
Are they still doing it? Are
¿Y
they
cómo es
going to be
que esto
happening soon?
va a balancear la pobreza que ahorita estamos pasando
And how are you
por
going to balance the
pandemia?
poverty that we're
La
having?
vivienda es muy alta, el agua es
The
muy
cost of
alta.
living is too high,
Y
the
en
water
realidad
is
los
scarce.
costos, como dice la muchacha, exactamente. Yo vengo de
I come
ahorita, la
from
semana pasada, de un tour de agua
last
donde
week from
las
a
personas están
water
tomando
tour,
agua contaminada.
and all the water was
Y esto va a
contaminated.
repuntar en el futuro en una enfermedad.
Is that going to
Nadie se
cause
les va a quitar un
illnesses in the
cáncer,
future?
una enfermedad grandísima.
There's going to be a
Ahora
lot
bien,
of
la
big
otra pregunta que tengo
diseases.
es, el
That's my
fondo de
question.
SAFER
How
es
is it
para
going to be
arreglar
safe?
este tipo de problemas.
Are you going to fix
¿A
those kind of
dónde
problems?
se está yendo este
Where are we
dinero
going
en
to?
realidad? Porque es fondo para la comunidad.
Because it's a funds
¿Dónde
to be
se
used
está
for the
yendo? ¿Se
community.
está usando o se usó para
They are being
cosas de la
used,
sequía?
or if they're going to be used for the drought.
La gente necesita agua.
People need water.
Como siempre decimos en la Junta,
Like we
agua
always say
es
in the
un
meetings,
recurso,
water is a resource.
¿cómo se dice? Un derecho humano.
It's a human right.
Entonces, si el agua tiene que ser saludable, como
The
siempre
water has to be
cantamos todos los que
healthy.
estamos aquí, el agua debe de ser saludable,
Water
el
has to
agua
be
también
healthy.
debe de ser accesible.
But it also should be
Para
accessible to for everyone.
Estemos en la ciudad, estemos en el campo.
Whether we're in
La
the
otra
city
cosa
or
que
in
yo
the
he
fields.
visto y me dio tanta tristeza pasar por
make
el
me
Freeway 99.
Very sad because
Fue casi llegando para mi casa
I was
cuando
just
miro
arriving home
dos lugares,
and there were
dos
two
rancheros
places,
diferentes,
two different
tirando
places.
tantísima agua.
They were throwing
Cuando
water
vengo de un
away.
tour de agua donde las personas están sobreviviendo únicamente con botellas
Even
de
when
agua,
people are living with they don't have that much water.
únicamente con contenedores de agua.
They only live with water
Caramba, ¿qué
containers.
estamos haciendo de todo
So
esto?
why are we doing all that?
Estamos aquí para arreglar
We are here
las
to
situaciones
fix
de donde
the
somos
situation.
pocos en todo California.
And that's in the whole
Y somos
California.
pocos los que nos atrevemos a salir de la sombra y decir lo que debe de ser.
And it's very
o
few
lo
of
que
us are going to come
sentimos,
out
lo
from
que
the
vemos.
darkness and tell what is
Porque es
supposed to be
triste, en
told.
verdad. Una cosa es estar aquí
One
ahorita
thing is
todos
to
en
be
la
like this
lo que es confortable aquí donde
comfortable,
estamos ahorita,
like we're
pero
right
allá
now,
afuera,
but
cuando vamos allá
outside,
afuera a la comunidad,
if
nos
we go
damos
outside in
cuenta de
the
lo que realmente
community,
está pasando.
you can see what people are
Por
going
eso
through.
pregunto,
That's why
¿el
I'm asking.
fondo que tienen de Safer realmente
The
está yendo a
fund
la
that is
comunidad?
done from
¿O
Safer
la
is just for the
comunidad va a seguir
community,
sobreviviendo únicamente con botellas de agua?
or people have to
Es
live with
una
bottled water
curita en
only?
una brecha tan grande.
It's a big
Y
gap,
esto debe de ser
and
ya.
that needs
No
to be
como dice la
happening
señorita,
now.
desde los 14 años a los
Like she
21
says,
hay un
across
trecho muy
that
largo.
since I was
7
14 years
años
old,
esperando para agua.
I've been waiting for water 7 years.
No tiene que ser así.
It doesn't have to be
Las
that way.
personas tenemos que salir de la sombra y no
We have
darnos
to come out
miedo.
of the
Yo hablo
darkness.
español,
I
entiendo muy
speak
poco el
Spanish. I
inglés,
understand very little English,
pero esto no me limita
but that
a no
doesn't
venir
limit
porque
me,
hay traducción.
because there's
Entonces, si dices
translations.
talleres,
There's
esa es
different
una de las
panels.
cosas. Los talleres, ¿a dónde están yendo?
Where are those panels?
¿Realmente están yendo a la
Where's-
comunidad?
where are
¿Quién
they
está
happening?
dando los
What
talleres? Yo
community?
quiero estar presente.
I want to be
Yo quiero
present.
cerciorarme que la gente está
I
siendo
want to make sure
realmente informada de lo que
people
está
are getting
pasando.
informed, get notifications, information.
Porque yo estuve en la comunidad,
Because I
2
was in the
tours de
community,
agua, y los 2 tours de agua no se
tour of
habla
water.
de esto.
And those tours, they don't talk
¿Cuándo
about
se
these
van a
problems.
arreglar todo esto?
When are they
Vamos a
gonna
seguir
fix all these
año
problems?
tras año tras
We're
año lo
living year
mismo.
after year.
Son 130 millones de dólares
It's
hasta
$130
2030.
million.
Entonces, ¿a dónde
So
se está
where
yendo
is
el
all the money
dinero?
going to?
La comunidad se está enfermando
The
y
community is
eso es
getting
algo que
sick.
me concierne a mí
And
directamente.
that bothers me directly,
Porque yo tomo ese tipo de agua.
because I
Aunque vivo en Baicelia.
drink that kind of water.
Ella vive en una comunidad cerquita.
She lives in a
Él vive en
near
otra comunidad.
community. He
Él
lives in
también.
another community.
Todos somos
But
parte
we
de
are
la
all
comunidad.
part of a big community.
Aquí es algo de no pelearnos los
This
unos
is
con
not
los
that
otros
we
porque
have to
todos
fight
nos
about all that.
necesitamos.
It's just because of the
Entonces,
things
¿qué es
that we
lo que
need.
vamos a hacer?
We need
Eso
to
se
know
debe
what we're
también
going to do.
de arreglar ya en
Try
este
to fix.
momento o
Are we
en
going
un
to fix
tiempo
this right
corto,
now, or is going to be a short
porque hay un
time?
fondo que se está yendo para un lado
Where is the
que
money
no
going
es el
to? It's
debido.
going different places, but not where it's supposed to.
Disculpen por mi comentario,
Yeah,
pero
sorry about my commentary.
muchísimas gracias.
But this is how I feel.
Thank you. So we do plan on hosting a number of workshops over the next year to help further enhance the methodologies used in the needs assessment. We do put out public notices and we send out email notifications through the Safer email list, both in English and in Spanish, to let people know when those workshops are taking place. They will all be virtual workshops, webinar format, and we do encourage you to participate. We're working out our schedule for those workshops, and we're trying to make them more focused. So we're doing affordability workshops this year, and we're going to do some cost model workshops as well, and then some at the very end, which are going to be how do we bring it all together. So we do encourage you to participate in those. If you're using the dashboard, and if you're looking at water systems, because the dashboard currently is only for public water systems, if you click on a water system and you go to their profile page, you'll see a summary of the amount of construction and planning funding that system has received since 2017, as well as the amount of funding we've spent to provide technical assistance to that community as well. So hopefully that helps answer your question around where funding is being distributed to these systems, but I'm sure our colleagues within the Division of Financial Assistance can provide additional details on that. I hope that answered your questions.
Me la contesta en un poquito, ¿verdad? Porque lo que yo pido es que si fuese más posible llevar estos talleres, no por correo electrónico.
So maybe you can give me information about these workshops in online so we can get that information.
Te lo digo por experiencia propia,
I
¿verdad?
do it because
Porque
of
la
private
gente
personal
no
experience.
usan la tecnología
Because
en
a lot of
un
people
lugar tan apartado
don't
como
use
son las montañas.
technology
El
in those
internet
places
no
that are
es
far
barato.
away.
Es tan caro como el agua.
It is so
Una
expensive
tableta las
as
personas no
water.
lo tienen. Y no tienen el tiempo para estar en la computadora el día entero, o como yo que estoy en el Facebook, no tienen ese tiempo. Ni tienen el tiempo para venir aquí. Tienen niños, van a la escuela, tienen algo más que hacer, tienen que vivir en el campo. Sí, y el del campo, que es el ranchero, está gastando el agua cuando el agua también se necesita en la comunidad. Por eso estoy pidiendo que en vez de estar aquí, hay que ir a la comunidad. La comunidad nos necesita.
I just need to know because all this information, a lot of people live out in the outside of the cities and different places where there's no technology. How else can we give all the information that they need? At this point, it is like, what do we do? What can we do in order to be able to get the information? Sometimes emails are not worth it or not enough because they don't have the technology. They don't have the ways to get information. Sometimes technology is even more expensive than water. So it's a no-win situation. So what can we do?
Absolutely, Maria Luisa. Thank you so much for your comments. And I think that you're highlighting the frustration that it takes, water management, right? It takes a really long time. So in the SAFER program, we have a number of different meetings and workshops that take place for different purposes. The workshops that Kristen was talking about was really focused on the needs assessment, the assessment that we do to understand how we prioritize water systems and domestic wells. And so they take public input to help us through that prioritization process. At the local community level, we have community meetings where our Division of Drinking Water and our Office of Public Participation go into the community to help that community establish either short-term or long-term solutions. During the pandemic, we were trying virtual, and now we've transitioned to hybrid. Now that we can meet in person, we have been meeting locally in that community. At the end of today's meeting, we'll show a slide where it has our SAFER calendar. And on our SAFER calendar, you'll be able to see the bigger public workshops like the one we're having today, as well as the local community meetings that take place in person, hybrid, with community members. But thank you so much for your comment. All right, we are behind schedule, but I want to check in with Sergio. We've got Sergio as our last speaker, and then we'll transition to our fund expenditure plan. Afterwards, we'll have a break.
Thank you. Just wanted to ask one simple question. We have these risk assessment that include water quality risk, drought, and socioeconomics. So I wonder if you have taken in consideration the element of climate change and how these intersect with this other risk assessment. That is a serious vulnerability that the community has, especially the ones that are not in proximity to main water municipal systems, but they are in a super isolated rural environment. How do we actually take in consideration those systems and how we can assist them through resources so they can be better protected towards climate change that include what we have going on in Northern California with these big fires that are going to become more and more stronger than ever before. How can we integrate that vulnerability when it comes to climate change with this risk assessment? Thank you.
No, it's an excellent question, but fire risk and other climate-related risks are embedded in the Department of Water Resources drought risk layer, if you're referring to the risk assessment for state smells and domestic wells. Yeah, so it is embedded in that layer. The analysis conducted by the Department of Water Resources, they look at their own portfolio of different risk indicators to come up with their risk assessment, which we then take the results, smack it on a map, and we do the combined assessment with water quality risk. So it's embedded, but not pulled out, I think, at the scale that perhaps you're looking for, but that's something that we can definitely consider in the future, is pulling that out so that it's a bit more prominent. Yep, it's a great suggestion. Thank you.
Awesome. Well, thank you all so much for your really helpful feedback and recommendations. I want to thank Kristen for her time, and I want to say we do have time at the end for questions towards the end of the day. At this time, we're going to be inviting Jeff from the Division of Financial Assistance. We're going to be transitioning to the second topic of our meeting today, which is on the fund expenditure plan. So this morning, Kristen talked to you all about a needs assessment. That's the way that the water system understands which water systems and domestic wells are at risk, and how can we use that to prioritize not only our funding, but our outreach. So where we're going in and working with local communities. Jeff is gonna talk about this year's draft fund expenditure plan priorities.
Good morning, everybody. My name is Jeff Wetzel. I'm a senior engineer over the Safe and Affordable Drinking Water Unit in the Division of Financial Assistance. And today I'll be talking about our efforts related to the SAFER program as we begin to prepare the draft fiscal year 2022-23 fund expenditure plan. We'll be discussing these later in our breakout groups, but these are the adopted priorities from last year's fund expenditure plan, which focused our efforts on small disadvantaged communities and low-income households. Walking through them, the first one, address any emergency or urgent funding needs where other emergency funds are not available and a critical water outage or shortage could occur without support from this fund. Address community water systems and school water systems consistently out of compliance with primary drinking water standards or at risk of failing. Accelerate consolidations for out of compliance, at-risk systems, as well as state smalls and domestic wells, and promote opportunities for regional scale consolidations. Expedite planning through use of technical assistance for systems out of compliance, at-risk systems, as well as state smalls and domestic wells. Next one is provide interim solutions, initiate planning efforts for long-term solutions, and fund capital projects for state smalls and domestic wells with source water above a primary maximum contaminant level or at risk of running dry due to drought. Lastly, ensure assistance is distributed in a manner consistent with the goals and directions provided in the State Water Board's Racial Equity Resolution and associated action plan. Last year's fund expenditure plan included a list of committed projects with specific demographics, and the upcoming fund expenditure plan will include similar information aligned with this year's needs assessment. This slide shows all the funding sources we have available for the broader SAFER program. For fiscal year 2021-22, these are the funds that were available to go towards drinking water projects in small communities. Note that the funds available for the upcoming fiscal year will look similar. For this last fiscal year, there was about $952 million available for capital projects like planning and construction, and that came from the Drinking Water State Revolving Fund, general obligation bonds such as Prop 1 and Prop 68, and from the Drinking Water Infrastructure funding from last year's Budget Act. There was also about $162 million for interim water supplies, emergencies, technical assistance, administrators, and operation and maintenance from the Safe and Affordable Drinking Water Fund, drought funding, and other general appropriations. This slide shows a few of our key metrics for the SAFER program and our performance for fiscal year 21-22. We provided interim solutions to 34 communities and 907 households. We provided technical assistance to 74 communities, or 25,746 households. We executed or completed planning assistant projects for 7 communities, benefiting approximately 318,000 people, and completed construction projects for 26 communities, benefiting 56,293 people. Pulling this all together, this assistance helped about 500,000 people. Additional performance metrics are included in the fund expenditure plan in section 10. And I also wanted to note that we do have a section that provides overview of the funding process and describes a number of process improvements that we are working on to improve our administrative efficiency. This slide touches on some of the SAFER program highlights from fiscal year 2021-22. In March, the board amended the intended use plan for the Drinking Water State Revolving Fund. The updates included modifying eligibility requirements for greater opportunities of 100% grant projects, a new eligible category for a medium disadvantaged community, less than 100,000 population, and applied some of the general funding, infrastructure, and other funding sources. Next one up, all of the drought dollars were committed from last year, and they primarily went to the regional programs for bottled and hauled water, as well as well replacement. There was also a solicitation put out for county-wide and regional programs with the counties. Staff held a workshop in March and has targeted their outreach efforts in high drought risk counties. With regards to administrators, a master administrator agreement was executed with Provost and Pritchard, and there also is a second master administrator agreement pending with Stantec. Staff are currently working on requests to award 3 different operation and maintenance funding agreements. Staff have also implemented a technical assistance request for qualification process that can qualify entities to be technical assistance providers that were not previously eligible. So far, 5 new providers have been approved to expand the technical assistance capacity. With regards to outreach and engagement, those efforts are ongoing with continued discussions surrounding strategy for partnerships. Megan will talk a little bit more about developing an approach to allocate the PFAS general fund. And lastly, the upcoming fiscal year 2022-23 fund expenditure plan will include additional program data and metrics. This slide shows the targets from the fund expenditure plan for 2021-22 versus what we actually committed during the fiscal year. Note that the black text is what was committed in the last year, and the grayed out text in parentheses is what was targeted in last year's fund expenditure plan. Looking across the top, we see interim water supply and emergencies. This includes solutions such as point of entry and point of use filtration devices, along with bottled and hauled water deliveries. The largest investments for interim water supply and emergencies included an amendment to the tanks and hauled water program in the Central Valley, and also a co-funded agreement with the Valley Water Collaborative to broaden water quality data collection for domestic wells to complement their work under CV salts. About $1 million was used for emergencies via technical assistance agreement in the Central Valley. An additional $11.7 million from various general fund appropriations went towards interim water supplies and emergencies as well. The reserved funding that we show there will be used for interim water supply and emergencies related to drought, including development of an additional countywide and regional programs for state smalls and or domestic wells if no other drought funding is available. Moving on to the next one across the top, technical assistance. These are agreements for non-governmental agencies to help communities with completing engineering environmental work for funding applications. The largest investments from the Safe and Affordable Drinking Water Fund were made towards technical assistance. There was 2 amendments to a technical assistance master agreements that extended those services through 2025. The reserve funding will be used to establish master agreements with the newly qualified technical assistance providers to improve overall capacity across the state. Next up across the top there for administrators, no safe and affordable drinking water funds were committed to administrators. The Budget Act of 2018 included $10 million from the general fund to fund administrators, and this last fiscal year, $5.7 million of that fund was committed towards administrators. For planning projects, with a large amount of funding available through the Budget Act of 2021 for drinking water infrastructure, no safe and affordable drinking water funds were committed in fiscal year 2021-22. Per the SAFER program priorities, it is expected that more planning projects will be directed to go through technical assistance. For direct operation and maintenance support, One direct operation and maintenance support project was committed from the Safe and Affordable Drinking Water Fund to support daily operation costs of East Orosi's Community Service District once an administrator is appointed. Reserve funding will be used to for direct operation and maintenance assistance. At this time, staff are developing a concept and strategy around goals for a direct operation and maintenance funding program with a standardized approach. This effort will use the results of the affordability assessment from the needs assessment and also take into account the affordability threshold once established. For construction, 3 construction projects were funded through Safe and Affordable Drinking Water Fund for systems out of compliance, at risk, and other community water systems. Again, with the large amount of funding available for drinking water infrastructure, only a small amount of Safe and Affordable Drinking Water Fund was committed to construction projects. For water system categories along the left-hand side, I'll just quickly mention that a majority of the funding went to technical assistance master agreements, and then also a large portion of funding went to interim solutions for communities and households served by domestic wells or state smalls. Along the bottom of the slide, 2 pilot projects were identified in last year's fund expenditure plan for innovative point-of-use technology and an operation and maintenance pilot. $3.2 million is still in reserve for use by the point-of-use, point-of-entry pilot. And lastly, actual staff costs for both administrative and implementation tasks associated with requirements of SB 200 were close to what was initially estimated. Here I'm going to mention some key concepts for the upcoming draft fund expenditure plan. Tribal technical assistance is currently offered, and various technical assistance providers are making good progress. But staff is also considering that it may be beneficial to have a dedicated provider that focuses on tribal needs. We have continued regional scale consolidation planning efforts with Placer County Water Agency and Coachella Valley Water District, along with others showing points of interest. I mentioned this earlier, but there's a new approval for technical assistance providers that will help improve capacity across the state once new funding agreements are in place. We talked a little bit about Senate Bill 552 already, but in September of 2021, that became effective and new requirements were placed on small water suppliers around drought planning. It's expected that funding sources will be available to implement, other funding sources will be available to implement Senate Bill 552 requirements. However, the Safe and Affordable Drinking Water Fund may be used for technical assistance for drought planning, especially for schools. Again, with operation and maintenance, we are working on a few initial commitments this fiscal year, and next year looking at setting up some initial criteria to expand this assistance. Regarding metrics, there will be a quarterly report out and a web posting on key metrics available. And I'll mention this once again, that we may need to allocate some of the Safe and Affordable Drinking Water Fund to fill drought funding needs until the 2022-23 drought funding from the new budget is available. Looking ahead, these are the next steps for the draft fund expenditure plan. Internal review of the plan will occur over the next 60 days. The anticipated public comment period will be in August, along with a board workshop. And we will respond to comments and revise the plan in September/October and bring it back to the board for their consideration at a November board meeting. That's it from my slides. Are there questions for the material I covered?
And again, advisory group members, if you have a question, you can turn your name tent, stand it up, and we will add you to the queue. And please also, as a reminder, speak into your microphone and make sure that the green light is on before you speak so that everyone here in person and online can hear you. Thank you. Castulo, we'll start with you.
Thank you, Jeff, for the presentation. I guess I was having a thought about just looking at the fund commitments, and you mentioned that a lot of it went to technical assistance, which included planning, um, and it seems like not a lot went to construction. And I just wanted to get a sense if it was because there weren't projects that were ready, or simply because you were able to get construction funding from the other buckets of funding that you have, and not necessarily had to come out of this particular bucket. And then related to that was whether you believe that because maybe we've spent so much in the planning effort now, that eventually those planning efforts are going to mature to shovel-ready projects, which will then now require construction funding. And so if you see a shift now going from technical assistance to construction, because those plans are getting to shovel-ready projects that need to be funded. And then if you could kind of retouch on what you mentioned about these master agreements and the administrators. It sounds like the administrators, at least from what I understood, are going to be now taking a portion of that TA funding also. Um, I just want to know if that's what you were saying. And then as it relates to your comment about funds specifically for tribal technical assistance, I just wanted to mention that there is a bill that's in the packet here, AB 2877 by Eduardo Garcia, which I think is trying to do that. And at least in our region, we did meet with one of our local tribes there that happened to be in the area where we are trying to consolidate system. That's the Torres Martinez tribe, and we had a conversation with their chairman to try to figure out how to incorporate projects that they would carry into the overall approach that the water district is pushing forward. And the reason is that in general, I would say that when you look at the Coachella Valley, let's say there's about 5 tribes. For the main part, those tribes are connected to the Coachella Valley Water District public water system. And so whether we're consolidating tribal allotted lands, or we're consolidating Riverside County area, or whatever we're consolidating, those new connections are coming into the water district, and it does require a level of coordination and effort with the water district. And so we were thinking in our conversation with, because I think this is something that even the assembly member understands in our particular region. It might not be the same everywhere, but in our region, this seems to be true, is that at least we believe that in the case of the Torres Martinez tribe, they don't have the bandwidth perhaps to carry projects through the planning phase, even if they were to receive technical assistance funding. So the idea was that the tribe would enter into an MOU with the water district, so that the water district could kind of act as its TA provider, develop projects, get them through the planning phase, and ultimately execute projects that would benefit the tribe. So understanding that the funding was for a tribe-specific project, but we need to think about. We've also had experience in our region through the Integrated Regional Water Management Program, where through the stakeholder process of how we divvy up the funding that comes to the Colorado River region, some of that money has gone to the tribe, and then the money has to go back to the pot because the tribe wasn't able to implement the project or deliver on the deliverables because of just the capacity maybe of the tribe, or its staffing, et cetera, whatever the case might be. So that is an issue that I think is real. We need to think about perhaps if someone else needs to kind of act as the TA, with the understanding that that money is meant for tribe-specific projects. And that's just a comment that I wanted to make. Thank you.
Thank you. Those are all good comments. Your first one for construction. So, yeah, because of last year's Budget Act for the drinking water infrastructure, there's a large amount of funding that can go towards construction projects. So safe and affordable drinking water fund being pretty versatile, well, I think the idea is kind of keep that in reserve to get at its versatility and let the infrastructure funding handle the construction. And think we might anticipate that going forward, even with the technical assistance. So the Safe and Affordable Drinking Water Fund would be used for the TA, and then as those projects become shovel-ready, hopefully there's still the drinking water infrastructure available. Your middle comment on administrators. So what I was trying to convey is the Safe and Affordable Drinking Water Fund obviously can be used to fund administrators, but there's a previous funding amount of about $10 million that's there. So these first wave of administrators are tapping into that funding that's already available.
Thank you.
So next up on my list, I have James.
Yeah, thanks for your presentation. Oh, sure, I'm sorry. Yeah, my question is on your visual there on the state small and domestic wells where you committed 13.4, but you had a goal or a target of 30.3. What is? Oh, must be dead. I'm sorry. So what is the thoughts of why the target was so off on that, the committed versus what you were hoping to spend on that budget? And then I might have a follow-up on that.
Okay. So we had that target. I mean, I think primarily what we thought we would fund state smalls through is the countywide and regional program, which Adriana mentioned, and we'll talk a little bit more about in the updates. But that's our primary avenue for getting funds to those folks. And so we did start that program last summer, and we've been trying to sort of increase outreach and solicit more counties to get involved in the program. And we specifically did a big workshop targeting county executive folks just at the end of May. And so we have started to see an uptick in applications. And that reserved portion of money shown in that column is with the hope that we'll be able to like bring more to that purpose in the near future.
So that number it wasn't a true goal going into this, but it's now a new kind of hope that
we'll
will
be able to bring it up closer to a level, something like that, yeah.
Yeah, I think I've got a little perspective on that, coming from Mendocino County, and I was aware of that countywide program, SAFER was providing, and trying to get that interest at a countywide level, to the Board of Supervisors in a county that doesn't have a viable water agency. We're in the makes of trying to get that together. So it was harder to get that message across to the county, those that are making the decisions of that need. And so, I think it can be a challenge for many counties to get that message across. So, yeah, that's just a comment.
Appreciated.
Sure. Thanks.
All right, thank you. Next up, I have Jianmin, and then Jonathan, and then Horacio.
I noticed that some money was set aside for PFAS, and in anticipation that chromium 6 MCL is going to be published, because in my county, that almost 20% of public water systems, they have elevated chromium 6. It's pretty prevalent in my county. So I'm just wondering when the MCL is published, whether some money would be set aside for that as well.
So the PFAS, again, we'll cover a little bit more in the updates, but that was a specific set aside in state law for that particular contaminant. But I think, we're definitely aware that there's going to be an influx of need associated with hexchrome, and we'll be, planning for that as we get certainly closer to the adoption of the MCL Yeah. Okay, next up, Jonathan, then Horacio, Sergio, Rami.
I'd like to thank Castulo for bringing this up. For more than 2 years, I've been talking about the waiver of sovereignty being a huge hurdle for tribal participation. And I've asked in numerous ways. I've sent in things in writing. A tribal chairman also sent a letter to the water board chair. And it seems like we keep hitting a brick wall. And I want to, first of all, say super thank you to the OPP. They've been super helpful in trying to navigate this. But the other offices within the water board, it's a brick wall. Nothing. And I ask and ask and ask, and I hear that, oh, well, it's stuck at OCC or this or that or whatever. I'm not aware of a statutory requirement for a waiver of tribal sovereignty. And yet, whenever we ask about it, it always hits a brick wall. Now, if this all seems sort of theoretical and, oh, the tribes have money and everything, BS. That's not true. I've got a tribal water system here in California that has challenges as bad as any water system in this entire state. They've been on a boil water notice for more than 6 years. And the folks at OPP approached them and started working with them, and things started seemed to be moving in some sort of productive direction. And as soon as talk of the waiver of sovereignty hit the table, they walked away. And their issues still remain. We work with them every day. We literally have somebody out there every single week, literally working hand in hand with this tribe, trying to get their system back in compliance. So aside from Assemblymember Garcia's bill, which obviously would be outstanding if it were to pass, has there been any internal progress on removing this barrier to tribal participation in the SAFER program? Thanks.
Yeah, thank you so much, Jonathan, not just for your question, but for your leadership and partnership as we kind of work through these challenges. Over the last couple of years, the water boards has done a lot of research, and what we've been doing is reaching out to other state agencies who also struggle with the same requirement. We've met with a number of state agencies and their legal teams, and we found that all state agencies are at that same place where we are. The way that the SAFER program has tried to increase flexibility is through our technical assistance. So for projects like planning, technical assistance, engineering studies, for interim supply, point of use, point of entry, for water system repairs, for operations and maintenance, for those type of water solutions, we have been able to work with the technical assistance provider to provide that solution. The challenge that we have is when it relates to capital infrastructure projects that require ongoing maintenance or ongoing monitoring. That's really where we're still working with our sister California state agencies to try to find a solution that that might work for all of us.
Thank you, Adriana. I'll just follow up and say that. Oh, never mind. I'll let it go. I don't want. There's a lot of people who need to talk. Thanks.
Okay, next up, Horacio, and then Sergio, Rami, Don, Sandra, and we'll close out with Jennifer.
Yeah, I have a question on the Open County and Regional Program Solicitation Help to stay small and domestic wells with drought and water quality needs. Can you explain a little bit what is this program consist of?
Oh, yeah, I forgot to introduce myself earlier. I'm Megan Tosney. I'm an Assistant Deputy Director in our Division of Financial Assistance. And so basically the idea behind the countywide and regional programs is that we'll provide a funding agreement or grant funding to a county, or if there's a nonprofit or some other public agency operating in that area that's willing to work on their behalf, that we'll look at that as well. And so basically they can address both water quality and drought needs for folks that are served by state smalls and domestic wells. So it can include, outreach and well sampling. It can include installing point of use, point of entry testing. It can include bottled water, hauled water, and also potentially even well replacement in areas that are impacted by drought and maybe don't have the potential to connect to a public water system, which of course is the long-term solution we're going to encourage wherever that's possible. I think I covered most of the bases, but it's pretty broad.
Is this program for every county in California? And is it about money that is going to be provided to the counties so they can
administer
and provide solutions for the people that don't have the means to put an application for their water systems? Because a lot of the water systems, people don't even have the time and the the means to apply on how are they going to get the solution for the water system, since the county has a plan for the county area on water use and land use. Why not the county be the main solution maker for the issues that we face in every county? So I guess what I'm getting in is that I think the county needs to have staff be ready to find solutions and have the money to provide their residents to get clean water.
Yeah, and the way this program is set up, the counties would be able to directly implement the kind of work that I described with funding support from us, specifically, primarily for low-income households is what we're targeting. And so, that said, though, if there are smaller public water systems in a county, we really have a lot of resources available here at the state and can work directly with our technical assistance providers to help them apply for funding and get through our process. The trick is just that we don't have the ability, eligibility-wise, to directly fund state smalls or domestic well owners. And so that's why the county is the best way to administer that funding directly to those folks.
The counties are willing to take the responsibility of providing the solutions that are needed?
So, we've seen, like I said, it's kind of a more gradual than we would have hoped uptick in applications coming in. We do have, I think, there's sort of, our initial outreach right now has been really focused on several counties that are targeted because they have a high likelihood of severe drought impacts this summer, and we want to try to get those through as quickly as possible so that we're ready to respond to those needs. So there's about 15 of those counties right now. A little more than half of them are funded in one form or another. And then the remaining balance, we are actively working with them to prepare their proposals. So that's just kind of an idea of kind of how things have been going. But we are certainly accepting applications from any county. It doesn't have to be one of those priority.
I think it would be a good idea to have every county be responsible for the residents, because we have public servants that everybody is pitching in to have the well-being of every Californian. And if the counties are part of the state, so we have to coordinate that the state and the counties be on the same page so we can find the solutions that are needed. Because if you have a water system that you get it fixed and 5 years later it's getting contaminated because it was not planned by local land use or water quantity or water quality, we're just throwing the money away.
Absolutely. The SAFER program really intends to partner with counties on that. And I think what I'm getting from our discussion today is that we want to make sure we add an item at our next advisory group meeting to talk specifically about domestic wells. By that time, we will have an update on how many counties have signed up for the program, so we can have a better understanding of where we need your support and other leadership to raise awareness about this opportunity. So we'll provide more information around domestic wells and where that program is when we meet in August. So thank you. All right, moving on.
Yeah, we have Sergio, followed by Rami, then Don, Sandra, and we'll end with Jennifer.
Yes, this is just related to the question that Horacio actually addressed. In the Eastern Coachella Valley, unfortunately, the community doesn't trust the county. So you need to actually develop a mechanism where you actually bring together the community with the county, and that's what Pueblo Unido does. So we have this ongoing TA assistant where we coordinate with the Environmental Health Department all the testing, all the regulations, all the maintenance that specific wells have at Polanco Parks, so they can be in compliance. That's the good news. That's the good news. So I want to just to make that quickly, that comment. Probably a model like that might be replicated in areas in Central Valley or Northern California. That definitely, is about the willing, is about having a nonprofit definitely have a really strong partnership with the community as well as with the county or the water districts that definitely find those solutions, because every single institution or organization have an expertise on that. Some people get to know better the community. Some other ones about engineering and all planning and construction, of course, operation and maintenance. My question is more specific about the stay small, which is what we focus on, the Polanco Parks. We know that even if we want to consolidate all of them, that would be the ideal scenario. That is not a reality, because the geographic remote location, due to the agricultural work they have in their vicinity, sometimes is financially unfeasible. So we need to be prepared to respond to that. So we will continue to provide that assistance to those small states with domestic wells. So my question specifically is, are these funding still open, going on, or do we have a kind of timetable? I think the idea will be to have it open all the time, because we receive feedback from the community having issues with wells, with water distribution, and fire protection and why not. So we would like to also be nimble and ready to actually submit application where it's needed. So I want to just to ask that.
Yeah, at this point, the intent is to just keep it open continuously. That's for the foreseeable future. I can commit to that. Yeah. Mm-hmm.
Okay, thank you. Next up is Rami.
Yeah, this is Rami Kalan. A question for the presenter. On the $1.2 billion donut chart, that was the available funds for SAFER programs. Do you know how much of that money has been allocated or spent in the fiscal year 21-22?
Yeah, I believe it was 900. Actually, no, I don't think we had showed that on that. I don't think we have those numbers quite compiled for today.
Okay, that's fine.
Yeah.
And my second question is right on that chart that you have there on the fund commitments for the technical assistance. That 46.5 million, is that contracts that you've executed with administrators such as Provost and Pritchard and others? I mean, what does that comprise, the 46.5 million?
So that's the funding agreements that we do have executed with our technical assistance providers.
Okay, so it's dollars that you've allocated to the technical assistance providers for their assistance to small water systems that you identify. Okay, and I think just one comment, what would help your presentation is when you made it, you presented a number of examples of water systems that had received assistance. It would be great to see that list here as well, just to show the group how you're using those dollars and which systems they're assisting. Thank you.
Okay, so next up we have Dawn, followed by Sandra, and then closing out with Jennifer.
Hello, this is Don, and I just wanted to speak to the consolidation and the tribal and the intertie in particular. I'm with Talawadini Nation, and they have their own small water system. First of all, you know, Talawadini Nation, they've been in the area that's there since time immemorial, before settlers, before any of that happened. We've had our own water system for, I don't know, since the early 60s. And then a community that's running parallel to our system, you know, currently, I don't know so like if we had to intertie, because it's not, we don't, it's really not an affordable system we have, because we have to do a surface water treatment, because up there is no sanitary seal. If there's a storm, I don't care whose water it is, they're getting a turbidity spike, you know. So I don't know whether that community has to treat to those standards, because it gets pretty costly from going from groundwater to a surface water treatment. And so I don't know if they have to do that or not. But what I do know is that I don't know, to put it like, are we being the tribe itself, because we purchase a lot of water from them for a lot of our commercial stuff, whether we're being treated fairly. So if we were to intertie and be completely dependent on this other community water system, then what precautions or safeguards or if any, would we have when we have our own system and it's been in play for quite some time? You know, we've been slowly buying our land back acre by acre and building our homes, and currently we're trying to build homes to bring people back to our area. And, you know, currently we want to hook up, say, 6 homes, and this community water system next to ours says that they don't have enough water. You know, so I don't know, you know, whose water system's more important, you know, to serve good quality drinking water, you know. So I just, you know, like the sovereignty deal, I don't know I don't know that I'd want to be dependent on a system that I'm not, and not just myself, is comfortable putting all their eggs into, you know. I don't know what kind of safeguards or what kind of process there is for that. I mean, like, you know, we purchase a piece of property now, and we're taking some of the homes down, and we take the homes down, and right underneath the floorboards are our stuff, fire pits, homes that were there already. I mean, they just built their homes right over top of it. And so there's a lot of generational stuff, and there's a lot of, I mean, I'm probably getting off point a little bit, but that's kind of what we deal with up there. So that's just my comment.
Yeah, thank you so much, Don. And I want to clarify that, so the State Water Board does not regulate tribal water systems. Federally regulated tribal water systems are regulated by the United States Environmental Protection Agency, but the SAFER program is available to support all water systems, including tribal water systems. In the event that a tribal water system would like to consolidate with a nearby public water system, that would have to be determined by tribal leadership. The State Water Board would not be able to mandate a consolidation between a federally regulated water system and a public regulated water system. So that would entirely be the tribe's decision, and the SAFER program is really here to support the tribal water systems to explore what available options exist, and then what would be the pros and cons of those available options, and if the SAFER program is a good fit for funding, how we might be able to support. I have a couple of colleagues who can talk a little bit more about consolidation safeguards. You mentioned that. What would it look like to consolidate two systems? I don't know, Michelle, if you want to come online and provide some clarity on that.
Yeah, I do. Can you see me, Adriana?
Yeah, you're big on our screen.
Oh dear. Okay. Well, Dawn, I just wanted to thank you for your comment and just say that I would be happy to kind of work with you and talk to you about the specifics of your case and what's going on up there. I do have a lot of surface water experience, having worked in Mendocino, Lake, and Napa counties. And so just, we can talk about some of the safeguards around consolidation. Some of them include Prop 218, like rate, elections that have to be done and things like that. But those will depend on the specifics of the water system you'd be consolidating with. So I will, if you want us to, I'd be happy. Let our colleagues know, and I will set up a meeting to meet with you and chat. So thanks.
Okay, thank you. So we'll have Sandra next, and then Jennifer, and then we will head into a 10-minute break.
Okay, so I'd like to start off with a little background to lead up to my question. So as of now, other entities have been deemed responsible for drinking water impacts, such as management zones and the GSAs. For nitrates, the State Water Board is still paying for nitrate remediation, when truly management zones should be paying for said costs. Also, in terms of the GSAs, they have revenue funds to address the drinking well impacts their over-extraction is causing. So my question is, when is the SAFER program planning on getting funding back from both of these entities, GSAs and management zones, who are truly responsible for causing drinking water impacts? This money can be used in other areas where funding may be lacking. So where is the urgency, or maybe better yet, is there an urgency to get these funds back? Thank you.
Yeah, I mean, we definitely are trying to look for ways to partner with the CV Salts folks and try to find ways to have their efforts to respond to their regulatory requirements kind of work together with things that we can do to potentially expand it. So for example, one thing that we've funded this year is one of the management zones, the Valley Water Collaborative. It's in the Modesto Turlock area. They obviously have started sampling for nitrate as part of their responsibilities under CV Salts. We've come in and provided joint funding so that when they go to those households, they can also sample for other contaminants and tell them more about their water quality. They're still responsible for the costs associated with the nitrate portion, and then we fund whatever incremental increase there might be. And then similarly, we're going to have a similar approach to deal with providing bottled water or point of use or whatever the interim solution might be. So that's one of the key things we're doing right now as far as, trying to partner but still hold them accountable for their responsibilities, of course. I think that's probably the main thing that I can refer to at this point. It's a big effort, obviously.
All right. Is that good? Okay, great. I have multiple pages of notes here, and instead of going down the list, I would just really like the Water Board to consider more of a holistic approach to these categories categories of solution types. So I think of SAFER as an umbrella of funding, and it would just be great if the TA started with an umbrella plan for the water system, and that TA provider stayed with that system from building their work plan, addressing the community's individual needs, and then all the way to the end of construction. We've all talked about, and I heard Mary Louisa also talk about the frustration of the years it takes to get your funding award. The years it takes after the funding award to you hire your contractor and to break ground. And I heard Jeff say, you know, we spent very little of this money so far on construction. And I understand that every pot of solution type has their own like red tape and bureaucracy. But, you know, as a TA provider, we have this pot of TA funding, and we can pass through some of that funding directly to support the community, to pay for their engineer and to get the project off the ground. But then, you know, we get through the planning phase, and we have maybe a couple months where we can stay with the community in our TA until that funding award for construction finally happens. And then we lose touch with the community. Same as if it's just a planning application only project where the state has deemed that this community isn't like an A project, like it's not an emergency. So we help them with their planning application, we get it all submitted to the state, and then we leave as TA providers because we're not funded to stay. And that's when the frustration for the community really comes in, because it's years with sometimes no contact. And especially with the communities that have no drinkable water right now, they're in a dire emergency. I just think that we could also consider some design build options. And it's really frustrating for the community where they're told, well, we can't fund bottled water or hauled water under TA. You're in a TA program right now. So then we'll give your TA provider funds and hours to go to clean up an abatement for emergency drinking water. The solution is to be holistic in the approach, to soften the lines between these types. And I know it can be done because we've done it under DWR funding, where we've actually helped the community design the project, we've hired the engineer, and I'll be darned, within 3 to 4 years, their tank is built, or they've rehabbed their well, or they have a new well, and we get to see that solution happen. And I did hear, I think it might have been you talking about the monitoring, after the project monitoring comes into play. Yeah, we develop monitoring plans, and the system submits those progress reports or those annual reports to the funder. And I'm just want to put out a positive that this can work if we really make it holistic. Thank you.
I just wanted to add a few points on that. One thing, there was a question about, you know, how much other funding sources are going to construction, being that we're not funding it here. And I just wanted to provide a little bit of context for that. So the allocation we had in last year's budget was $650 million for drinking water infrastructure. I don't have the exact number at my fingertips, but it's in the ballpark of around $200 million of that we committed to construction projects for small disadvantaged communities this fiscal year. So there's a lot of money going to construction. It's just not safe and affordable. As far as the TA goes, I definitely hear your point about trying to find ways to potentially merge TA with interim assistance, and I think that's something that we can look at more, you know, in the future. But the one thing I wanted to clarify is that we do approve work plans to continue working with the community during construction to help them with, you know, invoicing, progress reports, and so that is something that we can potentially do. But it looks like you have had a different experience, so let's hear it.
But this is what I'm saying, Megan. It's separate.
Mm-hmm.
Then it's a separate TA request. Then it's a TA request.
Well,
to come
we can
in
actually amend the existing work plan to add that. But I think the trick is it's a little ahead of things to commit money to that until we know they're actually going to get construction funding, is why we don't typically approve it right at the beginning. But we can amend the existing work plan to add that when we get to that point. I think that should be workable.
I agree with those flexible work plans when they can be phased, but we never will be called in either years after they've finished their planning project and now they're going to get their construction award. What I'm saying is just to have a TA provider or project manager to stay with that community from start to finish.
Yeah, I hear you. Yeah.
To provide a cohesive project.
Yeah, thank you, Jennifer. That's really great insight, especially coming from one of our most tapped in technical assistance providers, RCAC. So thank you for that. All right, folks, we are going to wrap up here, but we're not going to end our conversation on the fund expenditure plan. So the intention for today's meeting is we're going to be continuing our discussion in small breakout groups. Half of you are going to stay in this room, and half of you are going to move to the Klamath training room with Itzel. We are going to continue getting your feedback on the fund expenditure plan. And I'm going to list out the names of people who are going to stay in this room. After we list out the names of people who stay in this room, we're going to break for 10 minutes. And then after the break ends, you'll be back, whether in this room to kick off our discussion or in the Klamath room with Itzel to kick off the discussion over there. As you move to the Klamath room, I encourage you to bring your packet with you. We have discussion questions and the PowerPoint that you can refer to. And then we're going to have Division of Financial Assistance experts in both of the rooms. So you'll continue to have opportunity to meet with them. So here are the people who are going to stay in this room. In this room is going to be Maria Luisa, Camille, Jonathan Rash, Castulo, Jennifer, Rami, and then Michael Rincon. In the Klamath training room with Itzel is going to be Jian Min, Don, Horacio, Sergio, Cassie, Jim, and Sandra. All right, we are going to go on break. Our break is from 11:40 to 11:50. We'll see you back either here or in the Klamath. Thank you.
And as advisory group members go on break, I will use this time to remind our members of the public who are online or members of the public here in person, there is a section for public comment later on in this agenda. You can fill out these pink public comment cards if you're here in person. If you are online and watching us live, you can send your questions to safer@waterboards.ca.gov. And we will respond with instructions on how to join the Zoom meeting. All right, thanks, everyone.
I was just looking at what kind of clothes should I take? It's like 6. Okay, yeah. And I'll leave it on if you want. Yeah, we're gonna do it. You'll let me know? Yes, I will. The first time in Vegas. this strange 10-second technique tonight.
Folks, welcome back. We are about to get started. If you can go and find your seats. As we get started, I want to make an announcement for members of the public. You are welcome to join us virtually here in the Coastal Hearing Room or in person in the Klamath Training Room. All right, so like we mentioned, the purpose of today's breakout session is to continue our discussion on the fund expenditure plan like we were just having briefly. In your packet, slide 28 includes the 2022 fund expenditure plan priorities for reference. And I'm going to list out some of the questions that we have for you all, but here's what we want to do. Because we have about 20 minutes, if there's anything that you would like to share related to the fund expenditure plan that's not related to these questions I'm about to share, you're welcome to do so. Like Camille, I know that your hand was up, so I want to make sure that we will come to you first, and then everyone is welcome to share general questions. So here are the 3 discussion questions, or the 4 discussion questions for us. Based on what you've learned from the 2022 Drinking Water Needs Assessment, how do the priorities for funding need to be changed this year? Number 2, are there any water system categories or solution types that you recommend increase or reduce in funding in comparison to last year's funding allocations? And then the 3rd question, how else could we use a racial equity lens when distributing funding? So we'll go with Camille first, and then before we get started with our discussion, I also want to welcome Jasmine Oaxaca from the Division of Financial Assistance. She's our expert today, and she's going to be answering our questions.
Hi, everyone. Thanks, Adriana.
Go for it, Camille.
Thank you. Oh, so I don't know if this is helpful or possible at this point, but one of the things we brought up last time we met in person was that it would be so helpful to have a picture of all the SAFER funding streams so that we understand how the Safe and Affordable Drinking Water Fund fits into that. So for example, I'll use construction because it came up several times today, but Jeff talked about how we didn't have to allocate as much money out of the Safe and Affordable Drinking Water Fund to construction because it's coming from other pots. And I know we had the donut slide, but I think it would be helpful to have more granularity on which pots and how those solution sets map. That's probably not possible for today, but I think that that would better inform our conversation so that we understand where there are gaps in funding or where you're seeing greater demand in funding that isn't coming out of this program but is coming out of other programs, or where we can forecast where we think there'll be demand going forward. And I think it would be helpful, I know it's not in the framework of our discussion, but if we have any time, I really liked Jennifer's comment about thinking about our funding solution sets as part of a project that's multi-phased, and that when we think of TA or other things, we should think of it as a project-wide thing, and that maybe that is another way for us to think about how these different funding sources are packaged together. I know as a practical matter, that's what Division of Financial Assistance is doing, but I think it will inform the conversation we have here, because I feel like we only see one pot, and so we don't really fully know where there's pressure. Sorry, that was really long. I wanted it to be short, but that was long.
Thank you, Camille. I agree with you on both of those points. I think as we prepare for our workshop and later board consideration, and also our second meeting with you all, we can think of ways to better visualize the different funding sources by project solution type. So we'll think about how we can do that. And then I did want to say for the great idea that Jennifer had posed, I think that now that we're starting to do more what we call full planning through technical assistance, and kind of focus on that as one of our priorities is to try to expedite the planning process. So we've been using more and more technical assistance, but perhaps, as we move forward from this point, we can start to show, how a certain project developed in TA and then how it went through the larger funding process. So we can think of how to better showcase that in the future.
I'm sorry, my mic was off, but a reminder to please speak into the mic and then to use the names. I saw Castulo, then Jennifer.
Thank you. I just want to echo Camille's comments. I do recall her making the comment about trying to see the kind of the full breakdown of what the total pot of safer funding is allocated to, and I think even with the comment that was made earlier about it doesn't mean that there wasn't any construction money that went out. It didn't come out of this pot, but there are construction projects that are being funded. And to the point that was made about, this pot kind of being reserved for filling in the gaps because of how flexible it is. I think I'd like to get a sense of, if there are holes, what holes are those? And is this fund being used appropriately to fill in those gaps? I also tend to agree with the comments made about technical assistance kind of carrying projects from start to finish. But I think I have a twist to that. What I mean by that is more so on the consolidation projects, whereas I think the other example was completely open to even other solutions away from consolidation, like being able to move away from something and provide emergency water. But as it relates to consolidation projects, and this is a comment that I've made in the past, especially when you have large public agencies that I think have the capacity to carry projects from start to finish, whether it's a county, whether it's a large water district, and they are, they have the will to do the planning, to execute projects, making sure that those public agencies are being fully funded to carry the project from start to finish. And again, that might be happening, but it might not be happening from this pot of money, because I think I've brought that up in the past, and the answer that I've generally received is, yeah, we're doing that, but it's being handled somewhere else. So if it's being handled somewhere else, perfect. Maybe we don't need this particular funding for that, but again, I think it's just another reason why we do need the kind of the full scope of where all the funding is going to. Thank you.
So just to tag on to what I heard.
And then Jennifer, I don't think your mic is working. Could you use the orange one to your...
Is it working now? Yeah. Is it working now? How about now? Okay. So to add on to what Camille was saying about, these the different pots of funding and what they can be used for get very confusing and sometimes frustrating. But the good news is that they can be linked together. And so we're doing that on many projects where we're told, oh, well, SAFER can't be used for this, or Prop 1 can't be used for this, but hey, here's some IRWM funding. And we're stitching it together into something that will go from start to finish. And I did I did want to say that I heard what you said about the full planning projects, and those full planning projects, that whole concept is working really well. It's just that it would be so helpful if it were like an umbrella TA request or an umbrella sort of application, so to speak, that would work across all the different solution types. So if you're working on a full planning project for a community that cannot drink their water right now, then that umbrella should come with bottled water. So, or, a lot of times, for instance, right now, we're helping with construction management with a community who has not been able to drink their water for more than 10 years. And can you please get us some bottled water? Well, the time it would take to fill out the cleanup and abatement application for that bottled water and actually get it approved and the bottled water out there will probably be finished with the construction. So that's just what I'm talking about in an all-inclusive project where they probably could have had bottled water for quite a while now. I think we're all on the same page with that.
Bueno, puedo decir algo. Okay.
Well, I can say something.
Okay. Una de las cosas que ella está diciendo, sí, la infraestructura de llevar todo el agua a las comunidades cuesta mucho. Y mi pregunta sigue.
So all I'm saying is if the infrastructure to bring water to all the communities, then maybe
Está costando mucho en llevar a botellas de agua y contenedores de agua. Mi pregunta sigue lo mismo, ya que ella es una persona que es experta en economía.
no, my question is
Yo
the same
quiero
for her since
saber
she's a person that knows about economy.
cuánto dinero del programa que está en fondo de SAFER
How much of the money that is on SAFER
está realmente siendo usado o ha sido usado
is realmente utilized
para
or has been
solventar lo
used
que ha sido la sequía para las comunidades.
to help with the drought in the communities.
Por ejemplo, como dije en la otra conversación,
For example, what I said before,
dije que yo fui por el 99 y vi como dos de los rancheros están entrando tantísima agua.
I went through the 99 and I saw 2 ranchers throwing away water.
Entonces, si estas personas están absorbiendo más agua de la necesaria,
So if those 2 people are using more water than what they're allocated for, or more than they need,
y están secando los pozos de las comunidades,
and they're drying the wells in the communities,
entonces, ¿por qué no que sean ellos quienes tengan ese, todo lo que se gasta del SAFER, se gasta en la comunidad? ¿Por qué no ese dinero tenga que salir de la bolsa de ellos?
so then why, if they're wasting that water, why doesn't the money that we use for SAFER and everything that we use it for that, why doesn't that money come out of them? They're the one they're wasting.
Porque si ellos están haciendo el daño secando los pozos de la comunidad,
So if they're
¿por qué
doing the
no ese
damage
gasto,
of
en vez de que
drying
salga nada más de SAFER,
the wells
que
in the
es dinero
community,
para la comunidad? Si el ranchero está haciendo el daño en absorber más agua, ¿por qué SAFER tiene que pagar lo que el ranchero está haciendo?
so if they're spending so much water, why does SAFER have to pay for the amount of water that they are wasting? Why are not that responsible?
Yeah, thank you for the question. It's a difficult question, but I think we can point to the recent bill SB 552. These are certain requirements that are being put in place for both state small water systems and then also counties in the hopes to I guess, provide more resiliency to communities to respond to drought. Additionally, I do know that our colleagues in one of our other offices here, I believe they've been working towards water conservation regulations. I don't know, Adriana, if you know more about what the status is there, but that would perhaps get to your concern about wasting of water. And I know there's been a lot of messaging around, this is the third year of drought. I know we've been seeing quite a large uptick in, emergency funding requests to respond to both communities and water systems that are facing water outages. Yeah, sure. If you could show the other table, that would be helpful. Yes. So to get to your other question about how much funding has gone towards interim solutions and emergency response. So from the Safe and Affordable Drinking Water Fund itself, that would be the 13.4 million that we've spent towards the state smalls and domestic well communities. And I can add, and it's not shown here, but we've also spent an additional about 17 million this past fiscal year from other funding sources like the drought, and we had another general fund appropriation. So there is a lot of work in this area.
Yeah, thank you, Maria Luisa.
Just piggybacking on just the last one, is everything in interim water supplies and emergencies drought related? Meaning, are we not providing emergency water in other situations, like when there's a fire that takes out a system?
No, not necessarily. I mean, that's been the kind of at the forefront at the moment. And I did want to note that we're, per our priority, we're trying to use other appropriate funding sources like the drought general fund appropriation, unless we do not have access to that. And I see Michelle has popped on, so.
Yeah, thanks, Jasmine. I just wanted to add to the comment earlier that if folks are wasting water and they have a water right that has been curtailed, we do have a division of water rights here at the State Water Board that we could go and, express your concerns to. And also in a lot of these areas, there is the Sustainable Groundwater Management Act is starting to kick in. And so there is a forum to bring concerns in most areas that are at least critically overdrafted to as well. So I just wanted to follow up with that so that people realize there are avenues if water is being wasted.
Thank you, Michelle. Casulo, you want to respond? And then we'll move to Mikey, Rami, and then we'll close out our discussion.
Yeah, thank you. I just wanted to mention that in the past, we've cautioned or we've expressed concern about tapping into this fund for purposes of addressing drought-related issues. Understanding that, at least in my understanding, the purpose of this fund was to address more so kind of water quality issues. And so I would kind of just make that comment that in the past, as we started getting into this drought, we did make a comment about concerns about tapping into this funding to address drought issues, and that drought issues should be addressed with other funding that's meant for drought issues. As it relates to I'm kind of thinking about the fact that we've kind of expanded the needs assessment analysis from small systems to now like medium-sized systems, 30,000 connections, 100,000 people that are served by systems. I didn't get a clear sense of the percentage increase when you do the analysis on systems that are at risk, potentially at risk, not meeting, what was the percent increase in those different categories? I think that would help us with how we try to allocate funding to these different categories. So, for example, if there was a substantial increase in systems out of compliance, then maybe it makes sense to increase interim water emergency funding for that, or even perhaps technical assistance funding. So, I think if I had a clear sense of, hey, look, everything went up, then it gives me a sense of where we might need to put some money for that.
Thank you.
That's just a comment in general.
That's a great recommendation. Maybe, Michelle, if you have some time to, if you have that available, we'll go to some other commenters first and feedback. And then, Michelle, if you do have the understanding of increase in categories from out of compliance and at risk from last year to this year, that would be great to know. But now we're moving on to Mikey, Rami, and then come back to Michelle with that last question.
Well, actually, Rami was before me.
Oh, sorry about that. Rami?
Okay, thank you. This is Rami Kalon. I'll just stick to a few points here. So we're already in year 3 of the SAFER program, almost there, right? It's $130 million per year for just a very limited period of time. That's just 10 years. Let's keep in mind when the SAFER program was first envisioned, before we had SB 200, we had SB 693. The whole purpose of this program was to provide O&M expenses for small water systems. We've always had grants available to do capital projects, but what we haven't had is dollars for O&M expenses. So for the questions, of course we have to prioritize the human right to water list and the 300 or plus 346 failing water systems. And we have to focus on O&M. So, we saw the budget. We have a lot of technical assistance, which we're not sure what that means. I'm not anyways. But where's the O&M dollars? We all know about, I don't know, is it Kettleman City with the water treatment facility built that can't be operated? And I'm not sure that's the right example, but there are those situations. Or maybe Lanier. But it's in the Central Valley, and there's a lot of those. We're running out of time here, guys. That's all I wanted to say. Thank you.
Thanks for that. I did want to note that so some of these solutions, they do provide indirect O&M support, and we play into that. So TA is one of them. Administrator is another, as well as planning. And then we have been talking more about our direct O&M funding program. We had previously attempted to work through a pilot on that, but we recently decided to just kind of put more resources towards developing something that is perhaps streamlined, that we can take into account various affordability burdens identified in the needs assessment, or as the affordability threshold discussions get more firmed up. I know that there'll be a couple workshops in the coming months around that, but we're hoping to figure out a way to deploy kind of a more streamlined O&M funding program. So there'll be more to come on that, but we are working towards that.
Thanks, Rami, and thanks, Jasmine. Mikey, Jennifer, and then our other colleagues will be back soon.
Hi. Just kind of going off of what personally I think should be prioritized in terms of the needs assessment, and I think it's just systems that happen to fall under these categories. So I'd recommend that funding should be prioritized for small or domestic wells that that are at risk for drought and especially those that are in fire vulnerable areas, because that impacts infrastructure, which kind of goes to what Rami was talking about, operations and maintenance. That's extremely important. And then I would add on that any system or well that also falls under high affordability burden in DAC or in that affordability assessment. Yeah, any system that falls under a high affordability burden, and then especially those systems that are categorized as the human right to water. And I think that's it for now. I mean, anything that falls under those, or that checks off those, I think should be prioritized. And then to kind of bring it back to what, I forget, is it Cassie? Yeah, when she had mentioned about not losing focus, then definitely systems that that have less than 3,000 connections should be prioritized, but I'd also argue up to 5,000. Anything less than 5,000 should be prioritized at this time, because those are the systems that are more likely to be heavily impacted by drought, especially out in Northern California and in the Central Valley. But that's just my recommendations.
Awesome. Thank you, Mikey. Jennifer?
I'd just like to add on to what, can you hear me? Is that good? To what Rami said about O&M. It's been very confusing how to tap into those funds for both the TA provider and even for the state's grant administrators. So additional, like some instructions, guidelines for us would be really helpful. And then I can't remember, maybe it was Castulo had a question about what TA even was. I think that was what you said. So part of what TA can and has been is to assist the communities to hire their engineer, execute those engineering contracts, and to pass through funding to pay the engineers. So they're, you know, these systems can't afford to outlay the funds to pay the engineer, so TA pays the engineer directly. So that's a big part of what the TA is to get those funds out to the communities that need them.
And then can I just clarify, Jennifer, you said it would be helpful to have guidance for TA providers, or to become a TA provider, or for TA providers to navigate the program?
Specifically related to O&M.
To O&M, gotcha.
Both the grant administrators at the state level as well as the technical assistance providers need a little more guidance on how you can get those O&M funds out to your communities.
Gotcha. Thank you. Jonathan, and then Mikey, and then Castulo.
Thanks, Adriana. I want to piggyback off of what Rami and Jennifer said about direct O&M. I think that should be a big priority. I know this is something that you're still kind of developing. It's still kind of in the works, but I think this is really crucial. It's where the rubber meets the road, where you can probably get the most benefit, the immediate benefit to help communities now. Another thing I kind of wanted to talk about, the last question here about the racial equity lens, and just to kind of reiterate my point about the sovereignty. I don't want to belabor the point, but just to say that the state's treatment of tribes through the lens of the waiver of sovereignty, which is not necessarily, let's say, a racial thing. It's a government-to-government sort of policy, but it has an indirect effect of basically creating discrimination against Native American people who are on these tribal water systems. So I think that should be noted for the record. Thank you.
Thank you, Jonathan. Mikey?
Hi. I was also recommending, or I wanted to recommend also that in that technical assistance, and in operations and management funding, that some of those funds be available for local hiring and training, because I think at least in the urban areas in Southeast LA, I mean, we have a situation where several qualified like water operators are being shared amongst several small water systems, and that becomes an issue if, say, like there is a large failure in general. And so we think that one of the best ways to also empower the local communities is by training the folks who actually live in those communities to work for their communities, because one of the most important things is that local communities should be involved and have a say and be involved in the process of their own water. So if that funding can be available for local training and hiring, then that would be great.
That's a really great recommendation, Mikey. We have our colleagues coming in. Camille, if you want to give our last recommendation, and then we'll come back and close out as a group.
Sure, yeah. So I just wanted to reiterate what I heard other folks say, but I definitely think the fund needs to prioritize the human right to water communities, but I really would like us to see affordability taking a more prevalent role. I know others have said that, but I just wanted to underscore that again. Particularly, I mean, I am very focused on rural poverty in particular and affordability, but the reality is we're now seeing massive affordability failures that have been coming for a while in urban areas also and in cities, and particularly in the Bay Area and Southern California and Los Angeles. And so I think that if we are going to expand kind of the focus of which systems are receiving aid, especially the medium-sized systems, I think we need to like really begin to think about how we prioritize the affordability component without losing the original focus on small rural communities who have been suffering for decades as well with more systemic problems.
Close this out, yeah.
Yes. And it's regarding the O&M, because I keep hearing the O&M kind of being mentioned. I think we got to be responsible in how we divvy out the money for O&M, because it is a limited time for the funding that we have. And we need to make sure that if we're going to be giving O&M money to a system, that there's a long-term plan on how to get them out of a situation where they're going to continue to require O&M. So it needs to kind of either be paired up with some sort of consolidation long-term plan, or it needs to be, something needs to happen, whether it's being administered by one of the administrators, but we can't simply give out the O&M. As it's been mentioned, this is a 10-year fund. We're in year number 3, and if we give O&M for 5 years and we're just kind of sustaining what might be a problem system, we need to think about how to get out of that situation. So that's just a comment I wanted to make. Thank you.
And I'm sorry, I just have to add on to that a simple solution, a tie-in to that could be a requirement for a capital improvement plan. So you're getting O&M, and you're required to develop a CIP.
Great. Thank you all. Thank you both. I thank both groups for all of your feedback and your recommendations. This has been really helpful. Like many of you mentioned, this is the 3rd year of the program. And I think one of my biggest takeaways from what I've heard from you all is a reminder to come back to the original goal and the original intention of the program, and to make sure we're prioritizing small communities, operations and maintenance that wasn't available before, having a holistic approach from start to finish, and really looking at affordability and prioritizing those most impacted. We've taken a lot of notes, both here in person and also our colleagues online are taking notes. We will share our draft notes with you within 3 weeks so that you can make sure that we've captured your ideas. And afterwards, these notes are shared with our board members, and they consider that when they're making recommendations on how to prioritize funding. For some of the next steps, in terms of what we will come back to as an advisory group, we recognize that here we are only sharing about the Safe and Affordable Drinking Water Fund, and we've heard from you all, you would like more information about the entire SAFER program and what we're funding and what we're working on. So we'll work on that in the next couple of months to bring that back to this group. All right, so that closes out our morning discussion on the Safe and Affordable Fund Expenditure Plan. We are now going to be transitioning to public comment. The way we are going to be doing public comment is we're inviting members of the public to talk about either the Fund Expenditure Plan or the Safer Drinking Water Needs Assessment. We're going to start off first in person. And then we'll transition to the Zoom if there's anybody on Zoom that would like to provide a public comment. I'll pass the mic to Itzel to give instructions for that.
Yeah, thank you, Adriana. So if there is anyone here in person who would like to provide a public comment, you can raise your hand and someone will find you a microphone so that you can share. We ask that you keep your comments concise and succinct as much as possible so that we can allow multiple folks to provide comments if we have that opportunity. So again, concise. If anyone would like to speak and share a public comment, please raise your hand and one of our staff members will hand over a mic. Anyone? Okay. There we go.
Thank you. Hi, everyone. My name is Eric Oriana. I'm a policy advocate with Community Water Center. I just wanted to echo some comments that I've heard from community members here. One being really the need to accelerate solutions for communities. Many communities have been living with unsafe drinking water for decades, and so the state needs to have that urgency. For example, in East Porterville during the last drought, the state was able to provide a solution in under 3 years, and so we need to think more about how we can accelerate more projects like that along those lines. Really, folks have been, unsafe drinking water is not it's a public health crisis. We need to address it as such, and so we can't be moving slow. We have to move faster, and I appreciate and recognize the work that the staff is doing on this, but we just need to move faster. Another thing, there are other entities that are responsible for the impacts that we see to drinking water throughout the state. We need to ensure that those entities are being charged for the impacts they're causing on our communities. The SAFER program is not a funding source for them. This funding source is for the communities that have had unsafe drinking water for decades, and we need to respect and protect these funds as much as possible. I can just share that a lot of the communities that Community Water Center has worked with fought long and hard for the Safe and Affordable Drinking Water Fund, and it is not fair and it's not just for entities like the agricultural industry to pull money from this indirectly. Specifically, the management zones continue to pollute nitrates, drinking water with nitrates, and the State Water Board is still funding remediation for nitrate-impacted drinking water wells. And we need to ensure that that's not happening. We need to ensure that we're charging the adequate management zones, and that includes going beyond the collaborative agreements that the State Water Board has. It means charging them for the well testing, charging them for the POU and POE devices that have to be installed, and for the bottled water that communities are being provided. It's based on a principle of polluter pays. And then also for GSAs, we need to ensure that the drought impacts, we saw close to $13 million are being used for state small water systems and domestic wells. We need to be charging the GSAs. They have, just for example, Eastern Tule GSA has more than $11 million in GSA revenue generated fees, and they are a funding source, and we need to tap into that source. We need to work with the Department of Water Resources to ensure that those agencies are doing their part, and we really expect for the State Water Board to make that a priority for themselves. And then lastly, we need to work with the counties to ensure that they're doing their job as well. A lot of counties, specifically in the Central Valley and in the Central Coast, have long ignored the challenges that our communities have faced. One of the main reasons is that because many of the communities facing those challenges were low-income communities of color, and so there is a racial equity component to this, and we need to address this. We need to really embody the principles of the racial equity resolution that the State Water Board adopted last year, and we need to move with urgency on that. So those are my comments, and I appreciate everyone's input here today.
Thank you. And as a reminder to members of the public here in person or online, State Water Board staff will not be responding to comments, but we will be taking these down as notes that will eventually be published online as well as shared with our board. So with that, I will make one final call. If there is anyone else here in person who would like to make a public comment, please raise your hand and someone will run over with a mic. It looks like we do not have anyone else in person here who would like to make a comment. And so I will check in with my colleagues at the water boards to see if we've received any pink public comment cards from folks who maybe are not able or do not want to speak. I'm getting no, so no public comment cards. So with that, we will now move on to our members of the public who are participating online. Our colleague Elizabeth Herrera on Zoom. Do we have any folks who would like to make a public comment?
Thanks, Excel. We did receive one email, and it was asking some questions about the dashboard, specifically about the list, the status of funding for failing at-risk systems. Does the dashboard also list those? And is the DAC designation based on census block, tract, or place? And so that was the extent of the question, and that's the only one. Let me confirm that we've received so far. So, and I don't see any raised hands in our virtual room.
All right. Thank you so much, Elizabeth, for checking on that. As a reminder, folks online can continue to email us, safer@waterboards.ca.gov, and we can respond or confirm their emails that way. And with that, that will conclude public comment. So I'll pass the mic back over to you, Adriana.
All right, so we're transitioning to the tail end of our meeting where we're going to be discussing SAFER program updates. In your meeting packet and before the meeting, you should have received a packet with a number of different SAFER related updates. We will not be going in detail about the SAFER programs, but we will have an opportunity for you to ask questions about anything that you read. Today, Megan is going to be giving a brief presentation on PFAS funding. And after her presentation, you'll have an opportunity to ask her questions about PFAS funding, as well as any questions about the SAFER program updates. Before Megan begins, there's a couple of updates I want to make sure that you are aware of. Number one, in there we included updates that were made to the intended use plan. We discussed the intended use plan at a previous SAFER advisory group meeting, and you all gave really great feedback. So that feedback was considered when the intended use plan was revised. So please take a look at that update. Throughout today's meeting, we have discussed that we have launched a county and regional domestic well program, and right now we are working with counties to encourage them to apply to create programs to support domestic wells and state small water systems. As leaders in your community, we encourage you to work with your local counties to encourage them to apply to this funding. And one of the things we want to make sure is that you're aware of is this funding is also able to provide funding for county staff. So if county staff are low staffed and they need additional resources for that, they're able to, that this program is able to fund them. We're also able to provide technical assistance to counties that may not know the steps to take to develop a domestic well program. There are a number of legislative updates that are included in the program updates, including a potential amendment to Bagley-Keene that would allow virtual participation for statutory bodies like the SAFER Advisory Group. So please take a look at those updates. And then the last update I want to share is that we are always soliciting applications for additional technical assistance providers. And we really rely on partnership with technical assistance providers like RCAC, like Pueblo Unido, in order to accelerate solutions at the local level. So if your agency or your organization is interested in becoming a technical assistance provider, please reach out to us and we can provide more information about that. With that, I'll pass the mic to Megan, who will walk us through PFAS funding, and then we'll have a general Q&A to wrap up.
Okay, so I just wanted to preface and say that in the interest of time, I may skip over a couple of the slides and then just kind of go over the highlights that are most interesting for you all. Oh goodness. There we go. Okay. So the Budget Act of 2021, we've talked about it a little bit. There were some pretty significant allocations for us. Today, though, I'm going to focus on the $100 million for PFAS support to water systems. And we're anticipating that'll be phased over about 3 years that we'll receive those appropriations. And just to give a little bit of context for folks who may not be familiar with PFAS, it's a group of chemicals. There are actually thousands of them, and they're found in many different products. PFAS can be found in drinking water, and exposure can result in adverse health effects. And it's considered a new, or sometimes we refer to them as emerging contaminants, because we're still sort of learning about where it is and how to address it. So as far as the funding background, I just wanted to give sort of context that we're planning to administer this funding consistent with some of the existing processes that we have in the SAFER program to the extent possible. So we're anticipating that there will be a portion of funds directed to small disadvantaged communities, and we'll administer that consistent with priorities and criteria that are in our fund expenditure plan. And then we're also anticipating that a portion may be used for kind of our more typical construction projects, and that will run consistent with our drinking water state revolving fund process. And so then as far as the assistance for small disadvantaged communities, we had a workshop in March, and some proposals were discussed there. Tentatively, we were discussing a minimum $20 million sort of set aside dedicated to projects benefiting small disadvantaged communities that, like I said, would be funded consistent with the fund expenditure plan. Some of the potential project types we were envisioning include testing for small water systems. A lot of them have not yet been tested for PFAS, and that would potentially go through a technical assistance provider. Also, potentially pilot test or demonstration projects to help inform the design of, how small systems can address this contaminant. And then also potentially if there are areas where there are multiple small systems with PFAS, looking for opportunities to consolidate them and doing planning around that. So, and then I briefly wanted to touch on that we do have federal funding coming as part of the infrastructure from the federal government. There's a total of about $360 million we're anticipating to receive for drinking water over the next 5 years. That is framed a little bit more broadly. It's for contaminants of emerging concern, but we anticipate that PFAS will be a big focus of that funding as well. And so we're planning to cover sort of the criteria for all of that in our fiscal year 22-23 Drinking Water State Revolving Fund intended use plan. I wanted to note there is one error on this slide. It says it's planned for board consideration in July, and that's actually going to be September of 2022. And then as far as the path forward, so, I've already mentioned that we're planning to have information about how this funding will be administered in the Drinking Water State Revolving Fund IUP and the Safe and Affordable Drinking Water FEP. Both of those are anticipated to be released for public comment by August, and there will be workshops on each of those separately during the month of August as well, with proposals coming to the board for consideration of adoption in the fall of 2022. So I'd say the main takeaway here is just if this is something that you're interested in, please sign up for our email updates, and that's the best way to stay informed about our draft proposals and when things will be considered by the board and all of that. And that's it.
Awesome. Thank you so much, Megan. So we now have an opportunity. If you all have any questions for Megan, again, lift your name card and we'll come to you. And then if you don't have questions for Megan, but you do have questions about SAFER program updates, this is an opportunity as well. I saw Sergio first and then Horacio.
Thank you. I know that we are focusing on drinking water, but I noticed that there were some mentioning about wastewater projects here in this presentation, right? So, well, I want to just to also state that we have the decentralized version of a point of views on water with septics. Same situation goes with those Polanco parks that are not going to be able to consolidate to municipal services for sanitation. So they rely on septic systems. The problem is many of them did not build those up to code compliance, and they need to be basically rehabbed, pretty much engineered, done all over again. What kind of funding we can actually pursue on this to address those mobile home parks that are relying on septic systems?
So we are able to fund that type of work through our Clean Water State Revolving Fund program. It's, complex and probably something we should talk about in a separate setting. But, as far as who has the responsibility for construction and ultimate operation and maintenance of those systems and all of that, it is a little bit unique compared to working with publicly owned treatment works. So, but that is something that we can certainly discuss more offline and see if there's a workable solution.
Yeah, I have a question on the PFAS. Is this chemical already being ordered to be tested on all drinking water systems?
At this point, I don't think all systems have been required to sample. There has been fairly extensive sampling statewide. It's been focused more on areas where there are known potential dischargers that would be associated with the types of manufacturing or products or whatever that would be likely to have PFAS occurring in the environment. So, but like I said, one thing, we're realizing that there is potentially a lack of sampling at some of the smaller systems. And so that's something we would potentially look at funding with this new allocation. Mm-hmm.
Go for it, Sandra.
I'm not entirely sure if maybe I missed this, if you already said this, but would this fund development for testing for PFAS? Because my well was tested for PFAS for, I think, 70 different kinds, and it came out clean, fortunately, but I don't know that because there's thousands of others. So will this use funding to develop the testing for PFAS?
Yeah, that's a great question, and it is something that we're looking to try to support. There have been some ideas to look at setting up an analytical method that would basically test for total mass associated with PFAS contamination rather than individual specific constituents. And so we are potentially going to try to work with, in particular, probably with some of the larger systems that we may fund for construction, to have them collect data that would help inform that effort. Yeah.
Thanks, Sandra. Go for it, Don.
Yeah, the wastewater funding, that's interesting. I was wondering what kind of funding, I mean, because like around my area, in order to get a septic system, you have a raised bed or a mound system, which are basically made to fail. They only work for so long. We've installed like a package plant, MBR. Is there anything that would go towards like flushing toilets with the treated effluent and a piping that would go with that? Infrastructure in order to get to places, because that would take a lot off the drinking water, because we're using a lot of drinking water just to take waste away. So I don't know.
Yeah, I mean, historically, I'm not aware that we've funded anything that innovative, but doesn't mean that we're not open to, looking into opportunities where they might exist. Well, just to give a little bit of context on wastewater funding generally, I mentioned that we had $650 million last year for drinking water infrastructure. We do have a matching $650 million for wastewater that we've been, committing to projects. That is outlined in the criteria for that are outlined in our Clean Water State Revolving Fund program. There was a pretty significant set aside of $350 million for septic to sewer projects specifically. And so, I'm happy to maybe give a more in-depth presentation about that if it's of interest at the next update. But we do, certainly have a lot of resources going to that, and we're also setting up several new technical assistance agreements to focus on wastewater and helping develop those projects as well.
Great. Thank you, Megan. Castulo?
Regarding general funding for drinking water projects from whatever pot, whether the infrastructure money or the 130, has staff thought about funding pilot projects associated with treatment of chromium-6, specifically the stannous chloride? I know that it was mentioned that it's not considered the best available technology, and it would require systems to show that the treatment worked through some sort of pilot study or pilot program. And so I'm curious, just because chromium-6 impacts our regions significantly, and we probably in our region would like to use stannous chloride treatment technology. And just wondering if you've thought about whether those types of pilot programs would be something that could be funded through any of these funding opportunities.
The fund expenditure plan does talk about funding treatment pilot projects potentially. I think the one thing we'd kind of need to work through is that the safe and affordable funding is geared more towards addressing small disadvantaged communities. And so, are there opportunities where pilot testing that would benefit that type of community would work? But that's something that we could certainly explore more with you guys.
Thank you.
All right. Well, thank you so much, Megan, and thank you all for your questions and updates. Like always, you're welcome to call us or send us an email if there's anything that you want to get further information, or we can set up a separate time to have a meeting one-on-one. To round out our updates, on the screen you have the SAFER timeline. The one thing I do want to flag is that we can anticipate that the next SAFER advisory group meeting will take place sometime in August. When we have that date, you will get that invitation. And then the last advisory group meeting of the year, either the first week of December. So we will be sending out calendar invites shortly so that you can have those on hold. And then really briefly, just to round out our conversation, we wanted to have a few moments to see if any of you had any announcements or updates that you wanted to share with the group. We recognize this is our first time meeting together. All of you are engaged in many different drinking water projects. Are there any opportunities or announcements that folks would like to share with the group?
I have a quick announcement, and I was hoping I could share a map. It doesn't seem like I'm going to have the opportunity, but maybe I can share it with the group, and you can send out the map to the advisory group members. But I do want to make an announcement that we recently received about $23.4 million from State Water Resource Control Board. So we're very happy with that. And for the group, it was for purposes of funding what we're calling a regional project. It's about 5-mile pipeline that's going to act as critical backbone infrastructure that's going to open up the possibility of consolidating about 37 small water systems. We have a lot of information of how we got to that point. And so these regional projects are possible. And I think to the board members' comments here, the advisory group members' comments about, I think, the frustration of what it takes to get projects going and executed and funded. I think it's been my experience, at least in our region, that it does take some effort from either the large public water agency that supports the area or the county to come up with these regional master plans. They are complex. It requires a tremendous amount of data gathering. It requires putting plans together, engineering studies, doing hydraulic analysis on large water systems to figure out whether you have the capacity to add systems, storage, et cetera. Figuring out, especially when you deal with tribes, easement acquisition, working with the BIA, tribes, et cetera. So I get, I get what you're saying. It's a huge task, especially when you don't, when you're not focused on one particular system, but thousands of, not thousands, but dozens of systems within a region. So what I would encourage all of you to try to connect with your water agency elected officials, your directors, and your county supervisors. I think it was very crucial for us to get the data from the county. This is what started the mapping, the master plan. We worked with the county, and we said, "Hey, county, give us all the information related to your small water systems." And they had all the data. We GIS'd it and overlaid it with our existing water infrastructure. And with that, we kind of created a universe of systems that we can kind of reference against our infrastructure. And with that, we created 42 projects. 42 projects to consolidate about 100 small water systems. And so now with that plan in place, we created a priority of projects, those 42 projects. And we're focused on project number 1, project number 2, and as we get those done, we go to project number 3, project number 4. But it's a master plan that we've been able to put together, and it's allowed us to come to the State Water Board and very easily say, "Hey, look, here's a master plan that was put together in collaboration with the county, with the water district that's going to actually take over these systems, the nonprofits like Pueblo Unido, Leadership Council, the community members, these mobile home park owners." And it's something that's really, really worked well for us. So I'm just happy to announce that you've been able to support our efforts, and we're very thankful. Thank you.
Yes, thank you so much for sharing that, Castulo. Congratulations. And I think that it is possible with leadership like yours and with leadership like Coachella Valley Water District, bringing all parties together to get to a solution. Maybe an idea would be for us to hold some time for us to do more of a deep dive on that so that we can learn how we can apply lessons learned to other areas too.
Thank you.
So thank you. I see we have Sergio, and then we have time for one more, and then we'll close out our meeting. Sergio, Mikey, and then we'll close out our meeting.
Yes, I just wanted to echo what Castulo say. The leadership of Coachella Valley Water District is making this a reality. So it's a critical component to understand in every effort that we do that we need to have a leader, either it's a county or a municipal water system such as the Coachella Valley Water District. But I would like also to mention that everything began because the community got together and they pushed for this funding. We have been working with this since 2014, when we actually gathered a community survey and a workshop where the Polanco communities identify the top priorities for funding. So this has been a community-driven project ever since. We were just facilitating all the planning and design, and then together with the expertise of the water district, they figured out this is it. The backbone 33 inches transmission line is the one who is going to make this project a reality. So once again, it is critical that when we actually plan and work on these disadvantaged communities, number one, there has to be community involvement. Number two, you have to have the TAs actually being the interlink between the community and agencies. Number three, have the leadership of municipal systems such as the water district. And then once you have this vision, then you present that to the water board and how this is actually becoming a reality. Yeah, it's true, since 2014, but I'm not mentioning that these communities have been asking for this for over 20 years, 20 years. And I want to finish by saying this. This is thanks to public policy that is embedded on Proposition 1 that requires community involvement. That's how everything started to change in the landscape of rural communities in California. So now we have the tools. It's a matter of actually coordinating, putting all these components in place. So this model, as Castro explained, can be replicated in other rural communities. So thank you so much for your incredible support and for your leadership.
And thank you for your leadership too, and for remembering the origination of the idea, that it does come from community, and that is the model that is effective and that we need to follow. So thank you too. Awesome. Mikey, if you want to close us out.
Sure. Hi, everyone. Mikey again. I just wanted to share that we were recently part of 2 events, and I can share some of the resources from those events with the folks. The first, I was part of a UCLA panel in which I was able to talk about how to address the root of all these water issues from an advocate's perspective, and also how agencies, academics, et cetera, can actually work well with communities, and what are some of the lessons learned, which I think is really, really important, because there is a huge distrust between government in general and low income and communities of color. And so really addressing that issue and bridging that gap is really key for water justice in California. And yeah, and then the second one actually happened yesterday, which was a coalition of LA organizations, including us, came together around the state budget, and we were talking about what could be some possible water investments outside of, like SAFER, for example, that actually help address safe, clean, affordable, and accessible drinking water from the root of the issue, and what are some of the community-led projects that are being done in the LA area, in urban settings, and some of them might apply in other parts of the state too. So I can also share a recording of that, just as like a little resource for folks.
Thank you so much, Mikey. I'm so glad that you're able to share your expertise and leadership there too. So thank you for bringing that. We'd like to incorporate advisory group member announcements in future advisory group meetings. And for the example that of Coachella Valley regionalization, we'll think about having a separate time outside of the announcements to do a deeper dive. So for the next advisory group meeting, I know a number of you participate in panels and are really experts when it comes to safe drinking water. So we'd like to hear that, and we'd like to cross-pollinate here. With that brings us to the close of our meeting. I'm gonna pass the mic to Itzel, who is gonna walk us through just some close-out logistics. But I just wanna thank you so much. I know that many of you traveled from all across the state to be here, so we appreciate the time that you took and the expertise, and also your candor, right? I think that we are a year 3 of the SAFER program, and we really need your guidance and feedback to make sure that we're going in the right direction. So thank you for that.
Okay, folks. So just want to echo Adriana's point. Thank you all so much for being here. I have a couple of housekeeping items. We'll close out with our famous SAFER chant, and then we will stick around and take a picture. Okay, so housekeeping, number 1, you all in your packets should have a yellow piece of paper that says a SAFER advisory group meeting evaluation. We're going to ask that you fill that out and leave that here for us so that we can know how we can improve on these meetings going forward, and just generally what you thought about today's meeting. The next item I want to bring to y'all's attention is that some of you are looking to receive reimbursements for your travel to today's meeting. And if you know, or if you are interested in getting your travel costs reimbursed and you are eligible, please be sure to stick around so we can share some forms with you. And last housekeeping item is that your name tags, as well as your name tents, please be sure that you leave them here. So leave your evaluations, your name tags, your name tents, and stick around for reimbursement paperwork. Okay, so then we will close out with our SAFER chant, and then we will stick around and take a picture in recognition of the fact that this is the first time that this consultative body has come together in a little over 2 years. So we want to be sure to capture that. Okay, folks. So the SAFER chant goes, you're going to repeat after me, and we'll do it all together.
Yes.
Yeah, turn on your microphones. Let's let the people online hear us too. So everyone turn on your mics and repeat after me. Water should be safe.
Water should be safe.
Water will be safe.
Water will be safe.
Y ahora en español.
El agua debería ser sana.
El agua debería ser sana.
El agua será sana.
El agua será sana.
All right. Thank you all so much. Thanks for coming. Let's all take a picture after you fill out your evaluations.